long as Clay's here, right?
No, he's here.
As long as Clay's here.
I hope he can
It
talk
won't be the
about it.
same without the other two, but as long as Clay's here. The rock of the department. The rock of Gibraltar, rock and roll.
Or now, morning ago.
Look at Joe, he's trying to check the stock market over the phone.
Sounds good.
Look at it. Yeah, it was at 26.49 this morning, opened up at 78, I think, over.
Here comes Dr. Spire. He ain't coming in sideways,
What is this?
I don't
It's
know.
a big vehicle with a hat on? I thought we already gave them that property.
There's a change there. You didn't look at the book?
Yeah, but I didn't see this
not
thing
in
on
the
this
book.
edition, yeah.
Okay. When Dr. Spire is coming.
Here he comes, he's on the phone.
Him and Chuck were talking, he said, I thought for safe, that's all, Chuck hang up.
That's an important entry.
Morning. Morning.
Morning.
Right. Good.
I think you got a beat.
His mask is not sealed tight.
We ready?
Got a figure.
Fred, we ready?
Yes, sir.
Okay. I'm going to call to order the Jackson County Board of County Commissioners meeting for July the 14th. If you will, please stand for our invocation and pledge.
Lord, we just come to you this morning, thanking you, God, for the opportunity to come together and for these 5 men to make decisions, God, that will affect our future. I pray that you would help them to make decisions with wisdom and with your direction. And God, we do pray for our community, Lord, as our numbers have increased. And God, I know there's a lot of fear in the community and among staff and the citizens. And I just pray that your hand of peace would be on each and every one of them. I do pray that you would help us to make wise decisions that will impact this pandemic locally, and that you would just show us clearly what that is. In Jesus' name, amen.
Amen.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, Ms. Daniels, we have need approval of the agenda.
Yes, sir. We have 2 additions under section 1. Item X, request a board approval to seek bids on 3.689 acres of county-owned property on Panhandle Road for a no-kill animal shelter, and I'll share more about that when we get to that item. And then item Y, request board approval to purchase a bulldozer under state contract, which will be Scotty Taylor, and 2 deletions, one under section 1, item F, which is regarding the Northwest Florida Water Management District grant, and section 3, item A, which is to do with the ship mortgage subordination.
Chairman,
Yes.
I move approval of the agenda with the noted changes recommended or noticed by the county administrator.
Okay, we got a motion by Commissioner Spires, second by Commissioner Hill. All in favor, raise your right hand. All opposed, like sign. Motion carried 5-0. Okay, next on the agenda is the consent agenda items. Has everybody had a chance to review, and are there any questions or comments?
Yeah, I have a question.
Yes.
Scotty, are you on?
He is. He's just gonna. We'll have to unmute him.
Can y'all unmute Scotty?
I don't see his name in the list.
Disregard.
Excuse me. I found him.
All right, I'm on.
Okay.
Hey, Scotty,
Yes, sir.
this right-of-way permit on Wintergreen Road, where is that?
Where is it located?
Yes.
I don't have it right here in front of me exactly, but I can find out and I'll let you know before the end of the meeting. I'll grab it and let you know exactly.
Okay, thank you.
Yes, sir.
Okay. What's the pleasure of the board?
So
Chairman,
moved.
go ahead.
So moved, Mr. Chairman.
Second.
Okay, we got a motion by Commissioner Hill, second by Commissioner Peacock. All in favor, raise your right hand. All opposed, like sign. Motion carried 5-0. Okay, Miss Sandy Martin.
Morning.
Morning.
Thank you for giving me the opportunity to speak this morning. I have passed out some information for you, which is the unverified data this morning from our dashboard. This will be published later today. Statewide, our total cases is 291,647. In Jackson County, what we will report later today is 651 positive cases. That's a running total. That number never goes down when someone is no longer actively monitored. And you've asked me for the number of cases that are actively being monitored by us. I want to be clear, that does not mean that these cases do not still test positive. It does not mean that they are not still ill somewhat. But when we stop actively monitoring a case, what that means is they are past the window of infectious period, and we are no longer calling them every other day, okay? So out of our 651 cases, 197 are still being actively monitored by the health department. I did not bring you the number today on the number of public persons under investigation. Those are the people that include the contacts of those cases, because when I do that, people get confused about how many cases we have. So just to be clear, 651 cases of positive COVID in the county. 197 of those are currently actively being monitored by the health department. We've done 6,708 tests to date, which is a 9.7% positivity rate. That number is certainly increasing. I can tell you that they're lined up down the road this morning at the health department. We test from 9 to 11 Tuesdays and Thursdays through the month of July, and then I'll release some testing dates for August afterward, but I have to make sure that I have test kits and staffing to man those sites. People are showing up early, which is fine to do, but they are showing up earlier and earlier. This morning, I believe it was 7 o'clock. Our staff's not even there yet. That's of course fine to do, but please understand we start testing at 9 o'clock. If we're able to get set up early, then we do. And we stay for as long as we need to stay. But the test site is 9 to 11 Tuesday and Thursday mornings through the month of July. Okay, there's been some questions about the numbers recently, and I want to talk to you about how those numbers are reported. The Department of Health has a Florida dashboard, floridahealth.gov, and there's a dashboard that shows our numbers. This is not just me calling somebody up and saying, here's how many I have today. It is someone tests positive, and then they go into that database, and if it's before 6 a.m., then it gets reported on that day. If it's after 6 a.m., it gets reported on the next day. And so what happens, since antigen tests are now being counted, is someone is told that they are positive. Well, it's not on the dashboard today. It's probably not even on the dashboard tomorrow, because in those cases, I have to wait until that company gives me the information and we manually put it in. We are working with IT folks with those companies to see that we can get that done electronically. Most labs do report electronically, such as Quest and LabCorp. The big labs, they are already reporting electronically, but there is still a lag time in that. For instance, if there's a big test site going on at a long-term care facility or a prison, then those results come back to the people that tested them, including us in our drive-through. Those results come back to us, and we might call you and give you a result, but it doesn't hit our dashboard until that lab hits that button and the reporting happens. And so there could be a 48-hour lag time. So as a result of all of that, we have some numbers that I want to draw your attention to at GEO Prison in Graceville. GEO is reporting 123 positive inmates this morning and 8 staff. Now those 8 staff are within our numbers because those did get put out, but the 123, 74 of those got reported to us, and we have to manually enter those. We put those in. The rest are new labs coming in, and we're getting those entered as we can, but of course we're outside testing this morning. So those won't appear just yet. So you can expect another little jump in cases from GEO, and that's why there ends up being a discrepancy in numbers. Sometimes people go online and they get these numbers and they try to compare the two, and it just doesn't work. And that's why there's a lag time in that. We have one long-term care facility there that we have an outbreak right now, Mariana Health and Rehab. They report their numbers as well on an ACA website, and I report a number as I know to be true because we did testing on those. A good many of those are already in the database, but not all, and that number changes a lot. As of this morning, I have 48 residents positive from that facility and 56 staff. So what we've done to mitigate that, we started on the July 4th holiday. I got a call that we were seeing some symptomatic people, sent some people out to the hospital. The hospital has the ability to do a rapid test for their admissions. They do that, so we knew we had a couple of positives, and so the facility started separating those who are symptomatic from those who are not, sending out those that were critical to the hospital facility. So that's what we were working on. Come Tuesday of that week, we got some additional staff there at Mariana Health and Rehab, and as of yesterday, we brought in a whole team that includes a provider, nursing staff, support staff, to help that facility, get more stable, okay? We also brought in a team yesterday to test all remaining residents. They were all tested and only the 48 were positive, but we've tested all those negatives again because as you know, the disease process, just because you're negative today, doesn't mean you are negative tomorrow. So we're testing again just to be sure where we are, okay? Jackson Hospital surged tremendously. I had reported to you that we had 19 COVID beds at Jackson Hospital. That was a number we were comfortable with, 19. We currently have 36 in-house COVID at Jackson Hospital. Of that 36, 20 are from Mariana Health and Rehab. And that number is liable to change before I walk out of here. So just know that's what I know to be true right now. 36 are in-house at Jackson Hospital. 20 of those are Mariana Health and Rehab. 7 of those are in the ICU and on a ventilator. We do have remdesivir in stock. We've ordered more. And so I do believe those will all receive appropriate treatment as they go through their hospital stay. We had 19 vents with the ability to surge to a total of 21. So with 7 on the vent, we do have ventilators available. I'll stop there and see if you have any questions for me.
I do. Go ahead.
You too.
Raise your hand.
Go ahead, Mr. Locke.
So the 36 in Jackson Hospital, are those in the numbers of the 651? Are those included in that 651?
Yes, those are because those have been in the hospital and reported earlier. Yes, sir.
Are you having trouble getting any of the protective gear that y'all need?
We are not. We have good relationships with our vendors and certainly with the state, and we're not having any issues getting protective gear. I think we're in good shape. We're sharing that gear with anyone who needs it, although I've not had a request from the hospital or Mariana Health and Rehab or those facilities for gear, but we're in pretty good shape there.
I know you've got a plan, we've discussed it, about if you need more beds and that type of stuff. Are you preparing to activate that if the hospital goes above what they can carry?
Yes, sir. There's surge capacity, and then there's surge capacity, and then there's even more surge capacity. So before we move to a facility that's not quite ready and then try to staff that facility, we're in better shape surging where we are. And so that's what we've done. We've just moved things around, opened up more space at the current hospital and surged there. The next step would be to move to another facility, see if there are surrounding hospitals that have vacancies. And then of course we would surge outside that building, but right now we are. To that end, I worked the weekend in accordance with ACA and as well as our state epidemiologist and Jackson Hospital to move some of those stable patients out. So the state and ACA pays for beds at state facilities. We have one that's in Tallahassee, and we have one in Pensacola that's nearest to us. Those are COVID-only nursing homes. So there were several in the facility. I think we've moved out 8 so far that were in the hospital, became stable, could go back to the nursing home, except now they're COVID positive. So those did get moved out. So that's another way to deal with surge, is to move out the patients to make room for the more critical patients. So we're doing that daily.
Is the hospital having any trouble getting the drugs they need to treat these people?
They would like to get more than what they're getting, I do believe.
Okay.
Trouble getting, and no, sir, they did get a shipment on Monday, and that's something that we work on daily as well.
Is that remdesivir? Is that the way you pronounce it?
Yes, remdesivir, yes, sir.
So they're not having any trouble getting that, or is it limited?
As I said, they would like to have more than what they're getting. They did get a shipment on Monday, and we work on that daily.
Okay. You have plenty of masks, right?
Yes, sir.
Because I
If you
know
don't,
you
I
gave,
have some to give.
you gave me some and I appreciate it, and I've distributed 1,000 masks.
Yes, sir. We received, I believe, 45,000 masks in our first shipment and 22,500 in our second shipment. And we are still giving out masks in our drive-throughs, and we have them available for you to pass out as well if you like.
Thank you.
Commissioner Lockwood.
If the ones that tested positive were in a hospital and they had to leave, and they went to a state facility that's a COVID only,
Yes, sir.
in order for them to come back, don't they have to stay 21 days in that, before they can come back to the nursing home?
There are different rules surrounding returning to the nursing home. The most important is testing negative twice before they return to the nursing home. So yes, sir, that is a rule. Now, there are other mitigation strategies depending on the period of time that we're in. For instance, if the facility is able to care for those staff in a COVID wing and they have appropriate staffing to do so, then there could be an instance where we could move them sooner than that. So a lot of it's case by case, and it depends on where we are at the time. For instance, we've had nursing home patients in Jackson Hospital when we had 10 and 11. We had a few of them nursing home patients, and they were appropriate to send back to the nursing home, but we just kept them there at the time because that worked. That was not where we were this weekend, and so we moved some out to the state-run facility. So a lot of it depends on what else is going on in our community.
And the hospital, is that, what's the capacity, the official bed capacity of the hospital?
100.
100, okay,
Yes, sir.
thank you.
Commissioner Peacock.
The test results. What's the story on test results? Where are we?
Are you talking about the time frame for getting test results
Correct.
back? Yes, sir. Labs can turn around a test result in 48 hours. That's not what we've been experiencing. We tend to shop around for labs and try to find the one that's resulting faster, but everybody else does that too. And so what happens is labs, they get overwhelmed. I can tell you that we're getting results this morning from last Thursday's pod, which is 5 days. That's pretty good. Prior to that, we were at about 7 days, some of them 8 days. Interestingly, although we're getting some this morning from last Thursday's pod, there's still some from Monday of last week that I still don't have. So some of it depends on the lab, some of it depends on the timing where it lands there. None of that is within my control, other than I try to choose the lab that's most appropriate to run it at the time. I do know for certain that Quest is pretty behind, but we have a contracted lab that is now giving us some results pretty quickly. They've geared up at the state level, the Bureau of Public Health lab, in order to run more tests, and we're going to shift to running more there. I suspect when we do that, it'll initially be quick, just like every other lab, and then over time it'll get bogged down, and then you'll see us start to choose other labs to try and get quicker results.
Okay.
At this moment, I'm pretty comfortable with 7 days. And maybe 5. And we call from 8 a.m. to 8 p.m. 7 days a week. So if your lab hits on Saturday night at midnight, you can expect a call Sunday morning. So calling us and asking us is, it's pretty futile. We do call. We call 7 days a week. And just because you tested at the same time doesn't necessarily mean your lab is at the same time. We have one individual that's assigned that task. That's what she does. She carries a cell phone. She calls from that cell phone. That way, when you return the call, you call back to that cell phone. As you might imagine, that's problematic for her personal life, but it works for us for getting lab results out to you quickly.
Okay. Any more
I want to
questions?
clarify some numbers here. I believe I heard you say there was 36 at Jackson Hospital.
Yes, sir.
Okay, and 7 are on ventilators.
Yes, sir.
Okay. All right. And 20 of those are from Mariana Health and Rehab. Is that correct?
Yes, sir.
Okay. All right. Thank you.
Okay, thank you. I have a couple other things to remind you of. Avoid the 3 C's. Closed spaces with poor ventilation, like riding in a car with someone, or a very small office with someone. Avoid crowded places and avoid close contact in settings where you cannot maintain social distance. We, of course, encourage you to wear a mask when you're out in public or when you're in places that you can't maintain social distance. When you get tested, if you are symptomatic and you get tested and then you feel better, but you haven't yet heard from us your test results, please stay home because you were sick when you got tested. If you're getting tested just because you want to get tested, which is fine, and you were never sick, I get that. But if you were sick and you got tested for that reason, please stay isolated until we call you. We're having instances where we call people, they felt better about 2 days ago, and so they went out and they visited their parents and their loved ones, only to find out that now they're positive, and they were positive during that time. There is a symptoms-based strategy for releasing someone, and in general, it is very case-specific, but in general, 10 days from when your symptoms first develop. So don't just go out as soon as you feel better. Please stay isolated until you hear back from us. To that end, the vast majority of our cases are face-to-face contact. That's what we're seeing. People, when we call them, they know who they've been around and that person was sick. Sometimes they know they were positive, sometimes they don't, but they can remember being around someone who was sick. So very much face-to-face contact if you can avoid that and stay 6 feet away from other people. We do have a few people that tell us that they don't have any idea, and that would indicate community spread. A handful out of all these, maybe 3 or 4 are making statements like that. Most people are telling us about very close face-to-face contact with someone who was sick. The CDC has updated their description for a definition of symptoms to include sore throat, scratchy throat, runny nose, which, is allergy season. And so we have people that have such symptoms, and I understand it's extremely difficult to know what you should do about that. I take calls all day long advising people what to do about that, and I'm taking my best guess at it too. I encourage you to get tested. I encourage you to isolate if you are sick and wait for us to give you your test results before making another decision. That's all I have for you today.
Okay. Any more questions? Do we need to, Willian, do we need to open up?
It's up to you. There hasn't been any the last several times.
Sure.
Fred, can we see if there's anybody that has any questions for Miss Sandy while she's here?
Yes, sir. So if anyone from the public has any questions for Ms. Martin, they can use the raise hand feature on Zoom via a phone or desktop. If you're dialed in via the telephone number, you may use *9 to raise your hand. The first one is Joseph Baker.
Go ahead, Mr. Baker.
Can everyone hear me?
Yes.
All right. Good evening, everybody. Yes, I have a couple questions. In fact, 3. After you get tested, would you be able to supply the following information on COVID? Number 1, is there an electron micrograph of pure and fully characterized of this virus? Number 2, what is the name of the primary specialized peer-reviewed paperwork in which the virus is illustrated and its full genetic information described? Number 3, what is the name of the primary specialized peer-reviewed paperwork which provides unequivocal proof that the COVID-19 virus is the sole cause of a particular disease? And what I mean by that is, if someone tests positive for COVID-19, from my understanding, I would implore everyone to go check out Dr. Andrew Kaufman because the paperwork that the hospitals are getting is if it's assumed that someone has COVID in a death. You said that there was 36 deaths, I believe, that deaths, if you're assumed to be in contact with somebody, then on your death certificate, you were to label COVID-19 on it. So is there going to be any paperwork, or like I stated in my first question, which was, is there going to be an electron micrograph of the pure and fully characterized virus? Are we going to have more information on that, or? And I'll leave y'all with that.
Okay, I can answer one of those questions. The rest of those are more appropriate for the State Health Office in Tallahassee. The question regarding labeling deaths, I can only tell you my part of that. I will correct you. We do not have 36 deaths. We have 36 admitted in-house in Jackson Hospital. We have recorded 2 deaths so far in Jackson County. Regarding recording deaths, in our database that I spoke about earlier, if we are aware that someone has died, we simply go in there and we click that that individual's died, and we stop following that individual case. That does not mean that it reports on a death certificate as a COVID-19 death. It simply means exactly what we say. Someone who was diagnosed with COVID-19 is now deceased. We click the button, it reports out. So that's what that means. The rest of that, as far as determining cause of death, that's up to the medical examiner's office.
Okay. Fred, do we have another?
Yes. Next caller is Tori Willis.
Go ahead, Ms. Willis.
Good morning. I have a question, Ms. Martin. Are y'all currently working with the Jackson County School Board on implementing decisions for safety and what you expect for standards and stuff for the upcoming school year?
Yes, ma'am, we are. We work with them daily. We have another meeting tomorrow.
Okay. All right. That was my only question I had, that they were working directly with y'all. At what point do you think we're going to be able to have some guidance? There's a lot of parents very concerned and trying to make decisions, you know, about putting their children, you know, and of course teachers the same, you know, back to school in August. We're less than a month away.
Certainly, I understand that, and I understand your stress about that. I don't have a definitive answer for that. I know that the Department of Education advises the school board, and then we also serve as advisory. At the state level, Department of Education works with Department of Health, and they come together, and then they advise us at the county level. And then we take that under consideration, and we apply what's going on in our county to make decisions locally. And unfortunately, I don't have a definitive answer on exactly when a plan will be out. I know as soon as they can make that available, they will.
Yes, ma'am, I understand. All right, thank you so much.
You're welcome.
Okay, Fred, do we have any more?
If anyone else has questions for Ms. Martin, they may use *9 on a telephone or the raise hand feature on Zoom.
Okay.
At this time, I see no more hands.
Thank you, Ms. Martin. Doing a great job, just like always. We appreciate
Thank you.
what the
Appreciate
health
it.
department does for the citizens of Jackson County.
Thank you. Y'all have a good day.
Thank you. Okay, next on the agenda would be Mr. Jim Town.
Good morning, Mr. Chairman and Commissioners. I'm here to take questions regarding the Tri-County Airport reorganization. Before I do, I just want to bring you up to date very briefly. We've just completed $2.8 million worth of construction projects, paid the final retainage out last week, and effective July 1st, we're starting on a $750,000 phase 1 of a $1.5 million project that will pave the parking lots, realign the fences, etc. So I'm glad to talk about the reorganization of the authority to whatever extent you wish.
Okay, and this right here goes from 11 down to 9 seats on the board, right?
Yes, we're down from 15 to 9, and we had to rearrange the terms the way the act came out. So there's an interim term from July 1st until September 30th for those remaining on the board. And then October 1st, we start a 3-year term for everyone. But to get the rotation going, 3 seats will expire next year, 3 the year after, and then 3 the 3rd year. So there'll be a 3-year rotation.
Okay.
Mr. Chairman, I make a motion we approve this request.
Okay. Do I hear? We got a motion by Commissioner Peacock, second by Commissioner Spires. Any more discussion? Hearing none, all in favor, raise your right hand. All opposed, like sign, motion carried 5-0. Thank you, Mr. Towns.
Thank you for your support for the last 18 months.
There you go. Thank you. Okay. Item D, Ms. Willan Daniels.
Yes, this is going to be a presentation today by Smart City Capital. I believe Mr. Oscar Bode is on the phone. And I just wanted to say that we were contacted by Smart City Capital as well as Nokia about the possibility of entering into a memorandum of understanding. I'm actually not going to ask you to approve the MOU today. I just want you to hear the presentation. We'll be doing budget next week, so we can bring this back up then. But the MOU is in your packet that Michelle has reviewed and made a few comments on. And essentially the MOU just says that we will work with Smart City Capital for the next 4 months at no cost to us to determine if a partnership is viable regarding broadband. So with that, I will let Mr. Oscar give his presentation.
Thank you so much. Can you hear me okay?
Yes.
Okay, it's not allowing me to actually share the presentation on my side. It says that I can't share while there's other people sharing the screen. I guess since
I've changed that setting for you.
Thank you, sir. Can you see that, ladies and gentlemen?
Yes.
Perfect. So I just wanted to start first. The consortium team today is composed not just of Smart City Capital, but also by the Nokia team, headed up by Randy Williams. I'm not sure if Randy's still on the phone. He was having some difficulty there. Randy, if you're on, if you can introduce the team on the Nokia side, please. Okay. Just for the interest of time then, Nokia is a strategic partner of ours, of Smart City Capital. They're one of the leaders in providing true end-to-end. Randy Williams is the account executive for the Southeast. Also on the team is Mike O'Brien, one of the leading analysts and specializing in telecom across the US, doing very significant projects that are referenced by many people, including Chattanooga, Tennessee, and the rest of the Nokia team. On our side, on the Smart City Capital side, we have Rahul Bhardwaj, Managing Director for all of North America and all the projects. And I am Oscar Bode, the CEO of Smart City Capital. As was stated, this is correct. We're making the presentation to propose this engagement that at no cost of the city will allow us to develop a roadmap in conjunction with the city that could be actionable 90 to 120 days. What we're presenting was actually created, and we have an agreement with the Florida League of Cities, and we can bring in follow-up meetings, and they will be part of the process. Mike and Jeannie and assigned Chris from the team. This allows for the education across all 412 cities in Florida, a program that we've come to an agreement with FLC to allow the cities to understand that this option exists, how to leverage it, and then how to action it. So from that side, the background was really that clearly all of the large cities and counties, there was a lot of attention and support, but there was no significant way of being able to support small tier 2, tier 3 cities and counties across not just Florida, but the entire US. Because we are the leaders in the smart city projects, turnkey, where we do the entire design, build, operate, finance, and monetize, we knew that this was a requirement for thousands of cities across the United States. Thus, we were the first to put together this program that allows us to support cities of all sizes. We're very focused on inclusive impact across all cities, and this is what we'll be presenting today. What we start in this engagement process, if after the MOU is signed, which as was stated, the MOU is a non-binding document. It just allows us to have two assessments. One, that If a simple 6-7 page document is hard to get executed, then it may be difficult to work with a city of that nature when there's no commitment and there's no cost. The other side, it creates this 90, 120-day window so we can actually get something done. So from that perspective, it really allows to do that. The first step, we don't come in selling anything. We just listen. What is the city trying to achieve? We get that feedback. We try to see if any of those existing priorities are maybe part of a CIP program, a capital improvement program that maybe we can assume as part of the model. But at the very least, we want to understand what is the intention and the outcome, and then we then try to build a solution and a funding model around it that we can reduce it, in most cases, to no cost or very little cost for the city. So it's really about listening, not selling anything in the beginning. Again, just highlighting the fact that we focus on outcome-based model and funding, eliminate those barriers that we'll highlight in the next couple of slides, and then be able to actually have something that's actionable. You have this deck, but just to highlight, we're only going to speak to the left and right. On the left-hand side, whether we were discussing this project with Jackson or with New York City or Paris, it doesn't matter. The 3 adoption barriers are always the same. Most cities, big or small, do not have the understanding of how to leverage public-private partnerships to do things beyond roads and hospitals. And how to do an entire turnkey project is something that we can bring to eliminate that learning curve, as well as how to put together these things so value is optimized. The middle is also equally important, bringing funding to the project, and how do we bring these use cases in a way that allows for transparency, or for example, data, as you'll speak about later, is actually owned at all times by the county and cities, is different than other models. But this funding model allows us to be able to execute these projects. The third is, unlike in the past where one solution provider could do the entire project, smart city solutions connectivity require multiple providers, even just in the application, could be 5 to 7 solution providers. We tie that all together, so we solve or help to solve the 3 adoption gaps. On the right-hand side, the typical question is that, well, this typically sounds too good to be true. How do you guys generate the ability to repay this? We have a proven and very unique model that we have patented of how we bring together these solution cases. First, the connectivity, which is the main objective for the city. Both broadband, cellular, especially CBRS that we've been a proponent even before it was launched. Now it's real. Wi-Fi 6, which allows connectivity. And so the way we put that backbone of broadband and small cell connectivity allows us to build all the other use cases. The next layer up is saving share. Savings, not just from an LED, which people think mostly about, it's across all assets that the city would have. So energy, buildings, fleet, water, the general infrastructure, the ability to save somewhere between 10 to as much as 40% of what it costs to run all of those assets and free up material budget for the project. The third over time is the big data analytics. It's not what people think mostly about consumer. There's a small component of that, but that's been around for a long time. The major portion is enterprise. So this is for fleet management, for insurance companies, for private enterprises that have assets that are optimized when leveraging these smart city projects. So they become clients of the P3. They generate value, which they share with the P3. So how these 3 things come together, create the budget or unlock that budget so we can create the funding that's necessary. At the end of the day, we eliminate both the know-how, the funding, and through this unique model, the ability to do the entire project. The other component that we don't rely on, but we can leverage, because we are the leaders and we have so many projects ongoing, we have now various engagements, both with NTIA, so at the federal, at the state, with the DOT and others for respective grants that could apply. To the extent that those are eligible, we can apply those and then reduce the cost of the project and obviously increase the viability. But we don't typically rely on that. We use that as an enhancement. Having said that, the ability at the end of what we're discussing and we're presenting here, it's very important. At the end of the concession period, the P3 transfers all the assets to the city. So unlike others that come in and they own the fiber, they own the value, and they just maybe provide 1 or 2 strands, the intent here is to be able to create something that stays with the city at the end. Again, if the city doesn't want to do that, we can continue to run it after the end of the term period, but that's the intent. The data is owned by the city and it's provided to the P3 on a quasi-exclusive basis, again, because the city will stay with everything. And then we create something that we call the SOB board. It's an acronym for Strategic Architectural Advisory Board. It's a board that the city, the solution provider, the consortium, if we will, and the investor group all sit on. And it's a transparent board that allows to see exactly what's happening. We create some new policies, for example, an aesthetics policy that allows the city to regain some power back from the big service providers like the AT&T and Verizon, because it's been upheld already in federal court and appellate court for the cities to be able to maintain the aesthetics. So things of that nature, data policies that are very compliant and protective of public data, all of that builds the transparency and trust for your constituents, as well as they know that all these things will remain. This is just very briefly, we have 3 different solutions. Most and everything we will be discussing here is on your left-hand side. As you can see in the yellow highlight, this is the intent here is to fully de-risk the project, that if we, both on all sides decide to move forward at the end of the 120-day exploratory process, it's fully de-risked. Even on covering the project, we try to do some revenue share on top of the project. The right-hand side is some cities do have budget but lack the understanding and know-how, so they take the risk and we provide the solution on a kind of smart city as a service. In the middle is any share. And we could share 50-50, 70-30. So I wanted to stress that we have all 3 scenarios available, but we are really seeing most of them to be the one on the left that's fully de-risked for obvious reasons. And the pandemic has been even a greater reason for this thing. We can't have remote learning, remote work, telemedicine when there's no connectivity. We can't have when the solution is $200 a month connectivity or $150 where most people can't support it. Again, we try to have an inclusive target. The way the platform works, and again, this is as we have structured with the Florida League of Cities, we have our core infrastructure, which is Nokia and Jacobs and ourselves providing the solution. We can include on an agnostic basis any additional player. About 90% of the real solution providers in connectivity and smart city solutions are all working with us, like Microsoft, Philips, Panasonic, AWS, Amazon, etc. That would be based on what the city sees as its needs. So the solution provides as a platform. We can do, if the project is material enough, just the Jackson on its own, and we'll see that at the end. But to the extent that Jackson wants to serve more like a hub and be able to also provide smart city solutions to surrounding cities that might not be able to do it, we can also cluster Jackson with other cities to create a more of a portfolio of cities. So this process is pretty efficient. It executes and it allows us to have the connectivity as well as deliver some of the value-added solutions that are going to drive that economic development, improve quality of life, safety and security for all your residents, especially health, and being able to be sustainable in prolonged periods like we're seeing today with the pandemic. Once we have that connectivity in place, again, just highlighting, we're able to do those water, power, etc., connecting, and we have that working together. And how it works together optimizes the value, the ability to have smart agriculture, again, the education, the ability to connect and interact with the city from a connected government perspective and city services, all those things are enabled. The model that I understand sounds like a lot of information as it's coming at one time. The execution is quite simple and efficient. The bottom right denotes those 3 key revenue or budget creation, whether it be the connectivity through the broadband, small cell, the saving share that goes across all assets, and then the big data. All that revenue goes into the SPV, the public-private partnership. A collateral agent is assigned that's investment grade nature, so highly rated like Bank of America, PNC, one of the large institutions. As I told you, the board provides a very transparent reporting. So all dollars collected and all dollars spent are reported on a regular basis. So the citizens and the entire city can have transparency, ensuring that there's no $20,000 hammer and that everything is happening in an optimized. This model also, people tend to think, well, what are we paying more for? It's not that you're going to be paying more. You're actually going to be paying equal or less because we don't have a lot of the legacy costs that Comcast or somebody else would have. We're able to deliver the broadband at an extremely competitive price for 100 meg, 1 gig, even 10 gig. And all of the other solutions are provided at no cost, and it generates value not just from people and assets that are in the city, but even more so by assets that are driving through the city or are leveraging a mechanism where then the corridor becomes the intelligent corridor and creates the value. So the revenue comes in, the collateral agent ensures that the project components are being supported, again, the solution. And our models include the initial build, ongoing OpEx to operate the project, tech refresh, because obviously you need to ensure that based on the useful life, a light, radio has different useful lives. We can maintain the tech refresh. So the SLAs that are the service level that are agreed to are actually delivered, as well as we cover the cost of the funding, the cost of dollars to support the project. So it is truly turnkey. So that project is funded. Then we do the revenue share to the city. Then we have the funders are provided. The level of the term of the concession is typically 20 years. And why 20 years? Because there's an extensive build-out period, whether it be fiber and the rest of the component. There's a ramp up of the revenue, and you need to allow some time for that to happen. And again, this is under the scenario of fully de-risked. Once we actually have the final scope and the final project dollars that are required for the build, the operate, and the tech refresh, that term can be adjusted. But on average, and we're doing many projects across the U.S., it is 20 years. There's only one project that's 15 years, but that county is providing 30% of that project through availability payments. They're supporting out of their own budget. So again, this is very efficient, very transparent in how it works. The last project is where we are, the last slide, I'm sorry, is where we are today. We found that unless we had a clear roadmap, we could be in a discussion phase for many, many months, if not even a year and a half, tended to be the average time. Now, through this simple process, it allows the city, as well as our consortium, to get to the solution, to put together the roadmap, and then be able to execute. So from that perspective, we do the non-binding MOU. We then have, which you have the draft of it. After that's executed, the only thing that we ask of the city is to be able to bring the key stakeholders from the mayor's office, from the manager, the first responders, public works, etc., economic development. We then have a roundtable. We have several working sessions so we can actually have clearly what is it that the city is trying to achieve. How do we then come up with a priority of those lists? We may make a recommendation, for example, and again, I'm just using a random one. Having the connectivity across the city may be priority number 5 in some examples, but we propose to move it to number 3, plus one of the maybe Wi-Fi 6, because that can create budget to unlock and support priority 1, 2, and this one, because maybe safety and security that couldn't be monetized. So how we bring that together allows us to support projects, not just the connectivity, but some things that the connectivity can also support that would not be able to be monetized on its own. At the end of that 190, 120-day period, that's where we come to a joint decision. The city decides that based on what was presented and the fully de-risking and all those components and the draft documents that we share with you, right, that on its own would probably take the city several hundreds of thousands of dollars to get an advisor and to get all those documents. All that's provided at no cost to the city. We then are able to make a decision. Yes, we as a consortium and funding group are decided to move forward. The city decides to move forward, and then we're able to execute the project. 70% of our projects, an estimated move forward on a sole source basis because, again, it is fully de-risked. It is under the P3 policy, and we're able to leverage other agreements that are being leveraged across the state. There can be an RFP process. We're not opposed to that, but we actually, obviously, none of the intellectual property that we share then could be shared as part of the procurement. But we know that we would be very competitive on that process. Then we go, based on that, is the actual execution of the project. 10, 15, 20-year concession. We have a clear agreement. There's key metrics and KPIs that are agreed to. The board is established, as I highlighted. We have the whole roadmap where we can deliver phase 1. We try to do at least some deliverable within the first 9 months to 12 months. So there's a definitive result that can be demonstrated to the constituents by the commission and all of the city leaders. Then we have a phase 2. Obviously for us here, the main priority is the connectivity across the city. And maybe we can actually add some additional resources like the telemedicine or other application that supports remote learning and working. But at least that would make an availability for all the citizens to see, yes, this is making a difference. And it's not increasing my taxes. It's not increasing the debt burden for the city or the citizen. So that's the summary in terms of we establish the working team, do the MOU, have those working sessions. We agree with the city and the stakeholders the key metrics and outcomes, and then we execute the project. So I apologize if I went a little bit quick. I just wanted to make sure that we could summarize and still take questions and answers that we can provide for the City Commission.
Anybody got any questions?
I don't have any at this time. You said we're going to discuss this during budget next week about the MOU.
Yeah, I just wanted y'all to have time to review the MOU, and if you think of any more questions, I'm sure we could get Oscar on the phone at that time.
That's fine. Yes, we're here to serve.
Mr. Oscar, just one quick question. Of your experience, of your 70% that's moved forward at the end of your due diligence period, how many of those has exceeded in its entirety?
Well, I mean, to be honest, I mean, smart city projects are now starting to take place, right? To be fair, there's only a few that were happening across the United States. So this is a new asset class or a new asset. So they're actively engaged. So like, for example, we're engaged with Miami Gardens, Florida. We have a few others that are under NDA. You know, we have Aurora, Illinois, which is public, Oconee, Georgia. So right now we're actually in the design and implementation of those projects, but we have the #1 spot of all those doing. The good thing is, as you'll see in the documentation, the risk is eliminated entirely for the city, right? So the city has the ability to share on the upside, but you're not sharing on the downside. So there is no real opportunity risk of loss for the city. So we know that all of the other legal departments have reviewed the document, so it has been quite vetted. So we don't expect to have any concern. And we can also bring in the key representatives from the Florida League of Cities. They can share with you why they're working with us, what's happening here, because they did an extensive due diligence on us over a year period.
Commissioner Locke.
You mentioned earlier that you were working with Florida League of Cities.
Yes.
How many cities in the state of Florida have y'all successfully worked with?
Well, what we did, we signed the agreement late last year with the league. We've now had the way that we work with them is we have a roundtable session where we invite 10, jointly the league and Smart City Capital invites 10 to 12 cities. So out of the first 10, we've are engaged with 4 of those first 10 cities. The second 10 came right before the pandemic shut everything down. So cities like North Miami Beach, Doral. So now we've postponed those, but at least 3 of those initial 10 that we have engaged on the second round have stated that they want to move forward as soon as they're able to get past the pandemic. But like Miami Gardens, we have now the architecture, the scope. We're in the final contract execution, and that will start to launch. We are the finalists for Dade County, which is an RFP. There's only 3 finalists. We expect to be hopefully rated #1. That's a $1 billion project for the entire county. That took us almost 3 years to get to the point where we are there. So we can provide. We're also with Green Cove, Florida. It's somewhat closer to you in that area that we did with the league. We're also in the final definition of the scope that they want provided. And so we can continue to provide some additional information, but we expect after the pandemic that we should be able to start with at least an additional 6 cities will be able to move forward in an expedited fashion.
So you're referencing Mike, that's Mike Sittig, and Jeannie is Jeannie Garner.
Sorry, I couldn't hear you clearly. Please restate that.
For the league, you mentioned Mike and Jeannie, that was Mike Sittig and Jeannie Garner, is that correct?
Yes, sir. Yes, sir. And then they assigned Chris Wells to the project. So, but Jeannie and Mike were part and parcel of the whole vetting process and what we executed.
Thank you.
Thank you, sir. I'm going to close by thanking the commission for listening to us today. As we're stating, the intent here is to have a discussion that there's no cost, no risk, and at the end, hopefully we can at least help to build a roadmap that gets a plan in place. And more importantly, hopefully we can do something that helps to execute and make a reality connecting the city without having to use any of the city resources, and then have an asset that actually stays with the city at the turnover. So for me, it's personal because I was born and raised in Florida in a town called Opelika, Florida. So to me, that is an area that I know what connectivity can do to transform cities and to actually accelerate economic development. So I have a great interest to make sure that we can connect every city in Florida. So I do appreciate everyone's time.
Mr. Oscar, you keep referencing city, just to let you know, we are the county.
Correct.
Yeah, right. And I know that. So we're a large landmass county. So just want to make sure you got that in consideration.
No, correct. I apologize.
No, that's fine. But I wanted to make sure you didn't think we were a city.
No, it just gets mostly, but counties, you're right, sir. For example, we use interchangeable like Dade County, and we still reference cities. And for example, in Oconee, Georgia, that's a county that's somewhat similar, right? Large, pretty good landmass, and not too densely populated. So they have the ability to, covering a wide range of miles. A county is, one of those things that we are experiencing doing. But I apologize for the wrong nomenclature.
No, that's fine. I just want to make sure. I mean, we all, we got 12, 13 cities in our county. So, but anyway, thank you for your presentation, and we'll be discussing or looking at this during the budget. And thank you for being with us.
Great. Thank you so much. We look forward for the opportunity.
Okay. Next on the agenda will be item E. Mr. Eric Worrell, are you on the line?
I thought that was struck.
No, F was.
F was, oh.
I'm here. Can everyone hear me?
Yes, go ahead.
Okay. Mine's a lot more simple than the last presentation. I'm just requesting approval of a substantial completion and the attached punch list that's provided. I just want to be clear, this isn't final completion or anything, so there's still a lot of pending items to be done out there. Most of it's the aesthetics type things like sodding around the valve covers and service meter boxes, clean out some of the valve boxes as well and get the gravel in them for plans. Minor things like leaving the key for the actual control panel of the grinder stations in the actual control panel itself. And then make sure that all the wet wells are plumb and level. And then for the areas in the yard, we just noticed some spots where the contractor was just laying sod over the existing sod. And we just wanted them to clean it up and cut it in or blend it with some topsoil so that mowers will actually be able to ride over it without scalping it.
Okay, got a motion by Commissioner Lockie, second by Commissioner Peacock. All in favor, raise your right hand. All opposed, like sign, motion carried 5-0. Thank you, Eric.
Thank you.
Okay, next on the agenda will be item G, and that is David H. Melvin, Engineer.
Move it, Grant. Second.
Yeah. David?
I think he's having some technical problems on his end.
Yeah. Well, we have a motion on the floor now. We
And a
have,
second.
and a motion and a second. A motion by Commissioner Lockie, second by Commissioner Peacock. Any discussion? Hearing none, all in favor, raise your right hand. All opposed, like sign. Motion carried 5-0. Thank you, David. Okay, next on the agenda will be Michael John Milden and Judy Austin.
Morning, everybody. Can you hear me all right?
No.
Well, you know, a few years ago, if you went in the store and had a mask on, they called Lou. Now if you go in without one, they call Lou. So, everything's changed. I'm here to talk to you about employee benefits. I'm gonna go over briefly, what the renewals are, why we are where we are with the medical, and then Judy's gonna go over the different plans, that kind of thing. You have voluntary benefits, with standard, voluntary life, voluntary long-term disability, Humana Vision, MetLife Dental, US Able is the basic life, the $5,000 the county pays for the employees. Health Issues, the Teledoc program we put in last year. All of those benefits are rate hold, no change in benefits, moving forward, effective October 1. Any questions on that? All right, and then Group Blue Medicare is it's a retiree program, age 65 and older. Retirees have the option of getting on that plan. It's a single payer system. The benefits and the premiums are handed down by CMS. There is no negotiation of the premiums or the benefits. Last year, there was a rate reduction, a little bit of change in benefit, not much, maybe a couple of copays. This year, there's an increase on Plan 1, 7.6%, and Plan 2 is 8.58. There again, those plans are handed down by CMS, and it is what it is. You're still on the ProShare program. Basically, ProShare says every 2 years, the county will get back 50% of any gain that has been realized between Blue Cross and the county. This year would be the second year of this contract. Quite frankly, I don't expect any refund back due to the claims that have been incurred. The wellness funding, last year I negotiated a $35,000 wellness funding from Blue Cross for 2019, 2020, and 2021. And so you got the 35 last year, you'll get another 35 this year, and then next year, assuming you stay with Blue Cross, you get the other 35. Unfortunately, claims have not subsided. You are looking at a 15.83% increase. I ran that renewal through the software that I have through Xywave, and it came up at 16.6. We looked at 3 different experience periods, excuse me, 12-month periods. One of the renewals that Blue Cross came up with was a little over 21%. The claims experience was over 86%. Medical loss ratio, that doesn't include any retention costs or anything, that's just flat claims. Every dollar you pay in, every dollar paid out. So if you paid in $100, almost $87 was paid out in claims in that period. The renewal period was almost 78% claims experience, at 15.83% increase. And then we went back and looked at claims through May, that 12-month period. And if you didn't take out the high cost claims that went over and above your pooling level, which is a level that reinsurance kicks in, the claims experience was over, it was 101.2% or something. It was extremely high. Taking out the high cost claim, your claim experience got down between 92 and 94%. Unfortunately, there's a lot of claims out there. You know, a few years ago, we were looking at roughly 15%, got it down to 9.9. It should have stayed at 15%, quite frankly. Anybody got any questions? I know this is not good news, but it's warranted, unfortunately.
John, is any of this that we're incurring, do y'all keep track of the expenditures? Is it related to COVID-19? Is any of that reimbursable to the county?
I'd have to check on that. Yeah, I was listening to the presentation a while ago, wondering what that, the people in the nursing homes, what's that gonna do to Medicaid funding? Right. Because 85% of those beds are Medicaid.
Are you going to provide us something that will outline what these plans are that we're looking at?
You're talking about the medical?
Something I can look at.
We will, yeah, we will. Be glad to.
I don't want to vote on something I haven't looked at.
Right, and I don't think that's gonna be the recommendation this morning to go ahead and vote, is to, we just want to come in and show you, present to you what has been provided, and let you know where we're at. Judy was gonna go over the plans that we looked at, alternative plans. And so, anybody got any questions on the other stuff? I'll be glad you, provide you with whatever you need.
Okay, thank you.
So on this form that I passed out, after we got the news from Michael John, we sat down, went over, we asked him to find a couple other plans that were compatible with our current plan in an effort to mitigate some of the cost. So they did that, and we sat down last week with the insurance committee, and we went over. If you look at this, you'll see you have your first column, which is your current plan. It shows what your deductibles and out-of-pockets and co-insurances are. The next column is your current plan renewal. And then the next one is an alternate one and an alternate two plan that are similar to our current plan, but don't offer as good of a benefit, but are very similar in nature. So we met with the insurance committee and we reviewed the costs and the benefits associated with all three of the plans that Blue Cross Blue Shield came back with a quote on for us, for our group. And after looking at our current plan, which you're all familiar with how it's structured, if you look at the next one, alternate one, you'll see that your individual deductible and family deductible is the same, but your out-of-pocket maximum increases from what your current plan is. And then, and you have a 20% co-insurance instead of a 10%. That's the difference in those two. And on your alternate two plan, you have an increased deductible for your family and your individual, and you have an increased out-of-pocket. Your co-insurance remains the same. And each step down, alternate one, alternate two, is a less cost, but it's a less benefit to your employees also. So we sat down with the committee, we went over those options compared to our current and what the cost was, and in an effort to mitigate some of the increase that you'll see, the increase in your current plan from right now with your current enrollment to a renewal of that plan comes out to a difference in annual premium of $549,800. Now, what we did was the increase in your family cost would be offset by that. That's $72,205. You'll see it there in red. And then, at a recommendation of the committee, we're considering, or they are recommending that the board consider a reduction in the HRA funding of $500 for each individual, $500 for each family, and then if you have a couple that are their dual employee, then they would have $1,000 deduction in their HR funding because they would get, like, each one would get $1,000. So that was what we did, and today I just wanted to present this to you for your review so that you can look at it over the next few days And you can call me and ask me any questions. I can answer questions today for you, but we want to, hopefully then next week we'll be prepared to make a decision as how you want to proceed. I will tell you briefly that there was a motion made by the committee, that recommendation to renew the current medical group plan with a reduction in HRA funding of $500 per employee and family and $1,000 for a dual employee couple. The only difference, the only thing that does is it doesn't change any of the benefits or doesn't change the structure of the plan. It just puts a $500 responsibility on the employee for their deductible.
Ms. Judy, with the implementation of that, with the 500 individual and the $1,000 couple decrease, what money is that going to recoup off the difference of that 549,840?
Yes, sir, it comes off there, and then that brings it down to 395,840 minus your increase in your family premium, which is passed on, which is an increase of $48.92 per month, or $24 pay period. And that brings your total increase, if you went with that renewal plan, of $323,634.08. That's just in dollars, premium dollars. Then of course you have other monies that you've set aside to fund the HRA. And last year, the full fiscal year of last year, we expended $336,986 of that money. And currently in this fiscal year, we have budgeted $532.91, and we've expended $276,749. So you should fall out somewhere around that $350 mark. It looks like, just like you did last year, which would leave you a little money left in that's there, or that you have budgeted there to roll forward, $570,000.
So you're subtracting $500 of the HRA money for each individual. What is that? What is it?
Currently it's
15. Okay, so it'll go down to 1,000.
Yes, sir.
And the idea partly with that was that we offered them this new resource last year or all of us, through the teledoc program, Healthiest You, which we had very low utilization of that. But I think inadvertently they don't have a reason to use that because they're completely funded with medical. So the idea is to increase the use of the Healthiest You program by not fully funding and also lowering our costs.
We'll have to get broadband so they can do it.
Well, it can be used by phone, so most people should have access. But broadband would help to do it online, yes.
Okay, so my recommendation at this time is that we table it till next week's budget. Y'all have a chance to think about it. Call me in the meantime if you want to sit down and go over it individually, or have any more questions, or if you have any questions right now.
Okay. I'd entertain a motion to table.
So move, Mr. Chairman.
Okay. Okay, motion by Commissioner Peacock, second by Commissioner Lockie. All in favor, raise your right hand. All opposed, like the sign. Motion carried.
Thank you.
Okay, thank you. Okay, item I would be Mr. Scotty Taylor.
Good morning, board members. This is a request to seek bids from qualified contractor for the chip sealing of Collins Road, which it goes way back in time, but we finally received approval from FEMA to go out, seek bids to chip seal. I think it's about 1.49 miles from Highway 73 to Iron Bridge Road.
Okay. Got a motion by Commissioner Lockie, second by Commissioner Hill. All in favor, raise your right hand. Motion carried 5-0. Thank the good Lord. Has been a while. Go ahead, Scotty.
Item J comes from that same time frame, seeking board approval to seek bids from qualified contractors for the paving of Sweet Pond Road from State Road 69 to Lovedale Road. it goes back in time to the other two.
Okay, we've got a motion by Commissioner Lockie, second by Commissioner Hill. All in favor, raise your right hand. All opposed, like sign. Motion carried 5-0. Okay, Scotty, item K.
Item K, I'm requesting board approval to purchase track skier steer with mulching attachments under the state contract with capital outlay funds that were approved in the budget last year for road and bridge. In your packet, there is a quote under the state contract in there.
Okay, we got a motion by Commissioner Hill, second by Commissioner Peacock. All in favor, raise your right hand. All opposed, like sign. Motion carried 5-0. Okay,
Item L, this is more or less the formal agreement for Poosa Road that we had, y'all had approved earlier for us to go ahead and seek for David Melvin to begin the planning and design for Poosa Road. This is just the agreement with DEO that we need approved and signature on.
So move it, Chairman.
I think I got Commissioner Peacock with the motion and Commissioner Lockie with the second. All in favor, raise your right hand. All opposed, like sign. Motion carried 5-0. Okay, Scotty?
Item M is I'm requesting board approval to purchase 120 horsepower agricultural type tractor, which under state contract with a 90-inch Alamo 4 blade buzz bar. It's a true brush cutter that we can go down side the road and cut these bigger limbs and stuff. But I'm going to purchase under state contract with capital outlay funds that were approved in budget for last year for road and bridges.
Okay, got a motion by Commissioner Hill, second by Commissioner Lockie. All in favor, raise your right hand. All opposed, like sign. Motion carried 5-0. Thank you, Scotty.
Yes, sir.
We don't have anything else on here. No. Okay, Chief Bruner. Item N.
So we'll discuss all the District 3 funds. Is the school board putting any money in this?
Yes, sir. Good morning, Mr. Chairman. Can you hear me?
Yes.
Okay. My first item is board approval to purchase Stop the Bleed kits off of the buy board contract funded by the Florida Department of Health EMS matching grant and approved District 3 funds from previous meeting in the amount of $23,986.58. And this will purchase 621 Stop the Bleed kits.
Okay, we got a motion by Commissioner Lockie, second by Commissioner Hill. All in favor, raise your right hand. All opposed, like sign. Motion carried 5-0.
Thank you, sir.
Okay. Update on the Graceville Fire Station.
Okay. Item O, this is yesterday. We'll start with the station in Graceville at 5422 Cliff Street. The Baptist College has repaired the exterior top of the roof as well as the part on the exterior back wall. They still have 3 rooms on the interior to fix the ceiling on the inside. They have moved all the furniture out of the building. Yesterday, a representative from the tax collector's office and Mr. Howard from county maintenance and myself, we met up there. There's a few modifications, some electrical for a stove that has to be made and a washer and dryer. And they have to put 2 doors up, which Mr. Howard and maintenance wrote those items down, and they're going to jump on starting working on those pretty quick, probably this week. And we've got approval to go ahead and start those interior renovations to go ahead and move in there from the Baptist College. So that project's moving along quicker than we expected. They moved all their furniture out in a very quick manner on that building. So when we get that work completed, I will update Ms. Willan and the board on that work being done by our county maintenance. The fire station on Commercial Park Drive, the contractor was going to schedule for a certificate of occupancy through the building inspector. They had the electrician had a few minor pieces of work to do there. They had to start up the generator, do the full startup on it, do the check on it. They had a few, I guess, electrical small things that they had to complete, such as the roll-up doors still need to have the switches wired. They have to do, they did a final cleaning of the building. They're going to go back and do another cleaning once they do the touch-up on that building. As far as paint, they got some replacement of some ceiling tiles that when they were working and doing the electrical work, they're going to replace. They've got some adjustment of some windows that are inside that they're going to complete. They're going to test the fire alarm system on that, and we need to install the fire radio system in that building, and then we'll move forward from there. So he is working, they're working very diligently on that building, and we delivered our Cascade system last week with the help of Scotty and the road department, which we appreciate their help in delivering that equipment out there. The electrician's going to get that wired up for us to start filling our own SCBA bottles.
Okay.
When will it be complete?
He has not given me a completion date, but I plan on talking with him today, and I will forward it to Ms. Daniels and have her send it out to all of the commissioners as soon as I talk with Derek, the project manager for GAC.
Okay. Moving right on along to item P.
Yes, sir. This is item P is board approval to purchase medical items under the CARES Funding Act. The first, we're requesting 6 CareFusion Ravel ventilators in the total amount of $113,580. These are transport ventilators. Obviously, as you know, the COVID-19 pandemic causes severe respiratory issues to patients. A ventilator will provide less contact with the patient and having to aerosolize if a patient is needed to be intubated. And this will call for a closed system and a filtered system if we immediately use a ventilator on these patients. We currently do not have any ventilators, and we're asking for that funding under the CARES Act. The second item would be asking for 3 Stryker Power stretchers at the amount of $55,996.61. After each patient, the item that is needs to be deconned the most and touched and used the most with a patient is the stretcher itself. Following CDC guidelines with disinfecting, this takes the unit out of service for quite some time, leading to some backlog of calls. We do not have any stretchers in backup, so this will allow us to rotate a new clean stretcher in these units while the other one is being deconned and disinfected after each call. And the last item is 6 Baxter Sigma Spectrum IV pumps in the amount of $8,790, and this will all be under SAVIC contract pricing. As you know, patients that require intubation will need to be on a medicated drip, and these medications are weight-based drugs. We currently do not use any IV pumps, and so everything has to be calculated manually, and this would greatly help out with the reduction in any potential for medical errors and administering medications in the field.
Got a motion by Commissioner Hill, second by Commissioner Peacock. All in favor, raise your right hand. All opposed, like sign. Motion carried. Motion carried 5-0.
The source of funding would be the CARES Act. Yes.
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 But yeah.
Thank you, Commissioners.
Yes, sir. Okay, next on the agenda would be Miss Tracy Taylor. Item Q.
Morning.
Good morning.
Requesting board approval of the bid for the roadside litter pickup in the county road right-of-ways. At the May 26, 2020 board meeting, the board granted approval to initiate the RFP for litter pickup along the county road right-of-ways for approximately 1,045 miles We received 3 bids, with the lowest bid from T&N Foreclosed Property Preservation and Lawn Maintenance / Tree Service LLC in the amount of $41,800. Staff's also requesting board approval to use the standard contract for professional services that was previously approved by the board of the county attorney for these types of services.
Commissioner Hill.
I got a list of questions. Just a few. Are they bonded first and foremost? Do they complete the bond process for this amount?
I'll have to pull their packet, and see. I'll be glad to get back to you on that.
And the reason I'm saying that, it is so grossly under
Yes.
evaluated on the other ones, and I don't know where the evaluation comes in, but I'm thinking just the equipment alone. I mean, I don't know, again, I've never bought a side by side, but I'm sure, but I mean, how many, one of my questions is, how many crews do they plan to have? One crew that follows which? Because at one time, Scotty was saying we're gonna have 2 in each district, 2 of the 8 tractors. And then, of course, Commissioner Lockie would have, a zero turn, and then so all 5 districts could be simultaneously needing a litter pickup ahead of them. So my question is, and pardon the past expression, we got ourselves into a situation with someone from Dothan that, tried their best, I'm assuming, that to get, I just don't want to get, the evaluation on that is just
Extremely low. And I did reach out to them to make sure that they understood that this was an annual and that they weren't bidding on this, that wasn't their monthly amount.
That's right.
And they said, yes, it is annual. So Scotty has also reached out to them, and actually they came and met with him last week, I believe, and he took them down some of the county roads to make sure that they understood what the project was, what it was involved in, and they said, yes, they can do it.
Mr. Lockie.
I'm not arguing the price. I'd do it for 41,000 a cycle, okay? So, but I noticed on the bid packet, they did not provide proof of workman's comp insurance first of all, I don't know this company, period. And maybe they are set up to do things like this and they have the equipment that you're talking about and the crew, I don't know. So, but my issue would be, there's no proof of current liability insurance or workman's comp insurance. So I'm sure that.
We do require that.
Okay, but on the packet, on the opening, it said it wasn't provided in the document.
They did not provide it in their packet. True.
Okay, so we're doing type of contract, I would want that done, providing they provide that.
Yes.
So having said that, if you go to page 158 of the contract, under C, at the, close to the bottom, it references trash and litter removal will occur, but also says weed eating activities.
That was put in, this was also used as the mowing contract at one time, and so it's in there, but it only applies to what the work that they are doing for us. It's kind of giving you the cycle of what the weed eating is doing. It gives you the cycle on what the mowers are doing, and it's giving you the cycle on.
Well, I'd like to see that stricken because ordinary layperson could, yeah, because that.
What part are you saying, Commissioner Lockie?
Paragraph C, the second sentence.
Second sentence, okay,
It says will consist of, which makes you think that that's included in this contract that they're doing.
Well, who is doing the weed eating? Nobody?
I think Scotty's on the line.
Scotty?
We were using some of the QLM workers and trying to get into the areas to get the debris. But at this time, I'm working with the prison to see if we can get inmates back out to do it.
Okay. So we don't have anybody weed eating?
We don't have anybody.
Scotty?
Go ahead.
Yes, sir.
Were you comfortable with these people knowing what they're getting into?
I could find no reason to not. He provided a list of equipment. I spoke with one of his references, and nobody's had any trouble out of him. He's established in Crawfordville, but I could find no reason to reject it. He understood that it would be approximately $3,400 a month to pick up 1,045 miles.
Okay.
My calculation, Scotty, was 69.66 on per cycle, but for 6 cycles. My question is there an opportunity if this is so awarded that we could ask them to do a 7th month for another $6,967?
Well, this was
We
actually,
originally was at
this was
7.
actually 12 months. This was actually 12.
Oh, I know. I just was looking at if we could put that in the
This
office.
is 12 months.
This is 12 months.
It
Oh,
says
12 months. Oh,
six, but it only says 6 mowing
Yeah, that
cycles.
needs to come out
Yeah,
of
it needs to
there.
be clarified. So
Commissioner Spires wants them in his every month.
I do too.
Every week.
Right. The bid was 12. I think that's that old contract.
okay,
Before
that's fine. Okay, I see it now.
You need
Okay.
to correct that.
right, before the contract will be rewritten, before, I think that contract that's got to be the old one.
So this.
But it ought to be coordinated. It says somewhere here that it's coordinated with the mowing cycle,
Yes.
the trash pickup.
And that's
Yeah,
That's what I brought him over to ride, so we could coordinate with him, so he understood what he was getting into. And if we need to table it, and I need to have him come to the next board meeting, where he can.
I'm fine with it.
I'm fine.
But at this price, maybe we should extend the contract for more pickups, more months.
Was Michelle on? I guess
No, you'll have to add more to
You'll
it.
have to add more
If
money.
they had rebid it, then you got a delay there. I just wondered if this is awarded, so I guess my question, Scotty, to you directly is, how can you, I mean, I don't know how many teams of people, if you was.
He told me he had, up to 20 people, and he's got 4 to 5 side-by-sides, pickups, list of equipment. He said he would have 2 on each one. Okay. 1 on each side of the road going up and down. He felt like they could knock it out in 5 to 6, days through an area.
They would be following each group of tractors. Now, you said there's gonna be 2 in each district after this initial run, so there's gonna be 2 in each district, roughly.
Well, they're gonna be working in conjunction where the tractors are. So, to say 2 in each district, means and methods, that's kind of hard for me to say that there'll be 2 every time. Because if he sees that he can run, the way they do it on the interstate, they're moving way faster than the QLM guys ever dreamed of here. But as long as he can stay ahead of the tractors, I generally don't tell him means and methods.
Okay.
As long as he can keep it picked up where we're not hitting it.
Is there something in this contract that if it's not working out, we can terminate at any time?
It will be. There should be in any contract I've ever entered into, there's always a termination at will, if it's not working out.
My only concern is, again, with this disproportionate amount on bids, if we do, if he defuncts on this contractual agreement, he's out 41,800. If he does bond that, that's a drop in the bucket. Then we got to take the time.
I believe, don't we have if it's below 100,000 though, they don't have to bond?
Well,
that's a Michelle question, but I believe
that even puts us more in a vicarious position. If we have nothing to fall back on. If they get in there 6 weeks deep and say, oh, or 6 days into it and say this ain't working out, then we had to start that RFP contract again, right?
Yes, sir.
So then nothing's getting picked up. That's the only thing that scares me on something that is this disproportionate for a price evaluation.
Maybe the others are overpriced.
Huh? I didn't hear what they're overpriced. Well, that's true. That's true. But I just worry about us getting the situation we had before.
Yes.
I was gonna answer. Taylor, all of these items here, was it a requirement that the vendors meet these specifications?
Yes, sir, those are the forms that are in the bid packet that they submit. So it's
Well, then in areas where there's a no indicated, would that preclude that person or that firm from being considered?
no, sir, not necessarily. It could be that it's just contingent that they would have to turn in their insurance documents at the time they sign the contract.
And the county would have to be a named insured on the
Additional insured,
liability.
yes.
Correct. Always.
So if we award this bid, it'll be subject.
Contingent upon the proof of the
All
workers' comp
workers'
insurance and the
yes.
liability insurance.
So move, Mr. Chairman.
Okay.
Second.
We have a motion by Commissioner Hill, second by Commissioner Peacock. Any more discussion?
So the motion, to be clear, is contingent upon
The completion of all the no's turned to yeses on that check sheet, all the requirements by
That
the
are
board.
required.
And that's for 12 cycles.
Well, it didn't have a subcontractor.
Yeah,
list.
so-
Some of them
so-
won't have that.
So
Six
that
is what the contract.
the,
Yeah, but we need it to be 12.
required-
It's gonna be required for 12 cycles.
the
No,
requi-
but you're gonna have to rebid it if you go 12.
Okay, well, let's just do 6 right now, the follow
Yeah.
tractors.
Let's see
And
what
then
we
we'll
can
look at
do.
that, and then we'll test the word. That's my motion.
Okay. We got a motion by Commissioner Hill, second by Commissioner Peacock. All in favor, raise your right hand. All opposed, light sign blinking, start. Once he completes all this, I guess.
Immediately, as soon as we can get him paperwork, he said he could get started. So we'll get started on all that and get everything cleared up.
Yeah, but before he puts a piece of equipment in the county,
Yes.
he needs to make sure that
Yeah,
we
the
have
contract's
that.
gotta be signed.
Before they have those contingencies.
Yes.
When he turns his contract in, he's got to turn his insurance documents in.
Okay. Thank you, Ms. Tracy. Okay, Ms. Pam Pashard on item R. Yeah. Fred, is Ms. Pam on the line?
I don't know if she is on the line, but I'll go ahead and read those items for her.
Okay.
Item R is requesting board approval of task order number 5 for GP strategies relating to DR 4399.
So move, Mr. Chairman.
Second.
Okay, we got a motion by Commissioner Hill, second by Commissioner Peacock. All in favor, raise your right hand. All opposed, like sign, motion carried 5-0. Okay,
Second item is going to be approval of task orders 6, 7, and 8 for GP strategies in regard to DR 4399 and DR
Second.
4177.
got a motion by Commissioner Lockie. I think I got Peacock, had the second. All in favor, raise your right hand.
You catch up here, 6, 7, and
Yeah, we're on S.
6, 7, and 8.
okay.
That's task order for
181
4177 and road signs and 4399.
I'm with you.
Okay. Motion carried 5-0. Okay. Next will be,
T.
is that T? Item T, and that is Dan. That's Mr. Dan. Didn't mess up your last name. Kent. Dan, you
Hey.
online?
Yes, sir. Good morning, commissioners.
Yes, morning.
So I just wanted to start out Joey, could you check to see if Mr. Norman is on the phone as well?
I am, and I'll step in, Dan.
Okay, great. Thank you.
Cover this. Can everyone see the screen
Yes.
for our presentation? Give some high-level information on the overall financial summary of 4399. So Hurricane Michael to date, finance is showing close to $17 million expended. We have
T.
We're on item T,
This ain't good.
unless you want to go on with the next one.
For Cypress.
No.
Cypress Park.
Oh, I'm sorry. Go ahead then, Dan.
Okay. I'm trying to think of what not
Item
get the
T.
agenda for this.
I'll take care of this one, Dan. This is
Okay.
board approval of proposal for A&E services for Cypress Park. And he may not have known he was a presenter, so.
Okay.
So move, Mr. Chairman.
I got a question.
Okay, we got a
I'll second it for
motion.
discussion.
We got a motion by Commissioner Hill, second by Commissioner Peacock. Go ahead.
Is that building worth $20,570?
I mean, Chairman, I spoke to Pam the other day about this specific thing, just because there's a great gentleman, Mr. Brown, that, you know, is very interested in this moving forward. And originally, I think they tried to work with Michael that works as the engineer at Mariana Trust to get these done. And they found some complexity and complications in the trusses. And I asked Pam that same question about could we add to it just to make it justifiable to spend some engineering services to it. Wasn't sure if we could do it at this point in the game, because if you're spending that kind of money for services, it wasn't, you know, initially thought in its inception that maybe we could get more for our buck. So again, I'm not sure either how much this was. I mean, so I don't think the block itself, and correct me if I'm wrong, I went in it a few months back, it's solid concrete, walls, floor, and just wood trusses with metals on it. So I'm in that same boat as what's it worth, but we definitely need it there. So what's maybe another option?
Yes, sir.
That's a voting thing in Cypress.
Is it FEMA funds?
Yes.
Yeah.
Yes, sir.
Could we?
But 20,000 in engineering?
Yeah, because there was
That
something
building-
that happened. That was my call because originally, I don't remember the gentleman's name. Pam mentioned to me that there was a gentleman that we had hired that did roofing, and they thought with Michael working with us from the engineering at the Mariana Trust, between our crew and him, they could do it for very fast and very effective. Of course, that gentleman, I think, left our employment here, but Michael then got over there, from my understanding was, and Pam can correct me if I'm wrong, that they again had some discrepancy in the trusses and complexity they couldn't fix without an architect involved.
So they need to be engineered trusses is what you're saying?
Well, Michael does that. That's
Yes,
a
sir.
little.
Dan can speak to it. He knows about it.
Yeah, Eric, so you are spot on with that assessment. Mariana Trust bowed out because of the architectural nature. So we did have to engage an A&E firm for that to go ahead and follow through the plans. Those funds for the A&E costs are covered underneath the FEMA bandwidth.
What if you just tore the roof off and put new trusses on it and re-roof it?
Yeah, that I can't.
Save
Was there any structural
$20,000.
integrity imposed on that, or there's
Yeah,
anything that's wrong
put
with
a new
it?
building on top of that slab.
I would have to get back with you to the exact extent, but I do know that there were damages to the trusses that the reason why they did have to be replaced.
Yeah. Can we table this? Maybe you rescind yours?
Yeah. Mr. Chairman, I make a motion, we table this.
Okay, they're rescinding their motion and
I did
second on the approval, and
I'd like to sit down with them. and
Commissioner Peacock made a motion to table. Hill,
I made the motion.
second. Well, he just made,
It don't matter. It's either way. It don't matter.
y'all get with me.
We're
We
waiting.
got a
Go
motion
ahead.
here from Peacock and second by Commissioner Hill. All in favor of the table, raise your right hand. All opposed, like sign. Motion carried 5-0.
We're going to be requesting that y'all set a special meeting next Tuesday to discuss the admin building, so we could also discuss this building as well. If that were, I mean, we'll have a one-on-one as well if you need it, Commissioner Hill, but we can also discuss it.
Oh, that's fine. That'd be good. I'd like to meet maybe with A&E, but ahead of time too, see what else.
Okay.
What's the gentleman's name that's on the line?
Dan.
Dan. Yeah, if I could get with you maybe.
Yes, sir.
Thank you, Dan.
He's with you.
Yes, sir.
Okay.
Okay, item G, U. That would be Ms. Carlin.
This request is for board to set the budget workshops to begin Monday, July 20th through Thursday, July 30th from 9 a.m. to 3:30 p.m. Additionally, I would like to request that the board change the regularly scheduled meeting for Tuesday, July 28th, 2020 to a 9 a.m. meeting with budget to pick up after if necessary.
Okay, this threw me off because it says July 28th. And on our calendar, we got July 20th. So it is 20th, right?
It is 20, so it was, I'm sorry, so it said both board scheduled budget meetings and set July 28th meeting. So I apologize for that confusion. So yes, we want to
Okay.
set beginning Monday, July 20th,
From 9 a.m. until
3:30.
3:30, okay.
So move, Mr. Chairman.
Okay, got a motion. Do I hear a second? Then second by Commissioner, we got a motion by Commissioner Peacock, second by Commissioner Hill. All in favor, raise your right hand. All opposed, like sign. Motion carried 5-0. So now we start budget Monday, and our second meeting
Which is scheduled for the 28th. We would like to make a
Do it during the
morning
day.
at 9 o'clock.
at 9 a.m.
Okay.
Yes, sir.
Okay, good deal. So, I'll put it on your calendars.
Thank you.
Okay, next on the,
Better notify, advertise it that you're changing it.
okay, item B would be Miss
Me.
Daniels.
This is to request to set a special meeting for July 28th at 10 a.m. So this will go immediately after your the meeting you just changed to 9 a.m. to discuss the admin and Lewis facilities as well as other matters that may arise.
So moved.
Got a motion by Commissioner Peacock, a second by Commissioner Hill. All in favor, raise your right hand. All opposed, like sign. Motion carried 5-0. Okay, Ms. Daniels, next item.
Yes. Over there. This is a request for board approval of a supplemental agreement between Jackson County, Florida and Waste Management. This is specifically to incorporate the code enforcement dumpster program that you all recently heard about and adopted, and to make it an official between us and Waste Management for 10 roll-off dumpsters for the program at a reduced rate to the county. And Mr. Bell should be on the line if you have any questions specifically for him about it. Ms. Jordan did review this and is okay with the agreement.
So moved, Mr. Chairman.
Second. Okay, we got a motion by Commissioner Peacock, second by Commissioner Spires. Any discussion? Hearing none, all in favor, raise your right hand. All opposed, like sign. Motion carried 5-0. Okay, item X would be Ms. Willand.
This is a request for the board to consider approving us seeking bids on a 3.689 acres of county-owned property on Panhandle Road for a no-kill animal shelter. As you all know, we recently entered into leasing, a long-term lease to Partners for Pets on the Endeavor property. For a number of reasons, that property is no longer as viable for their need due to the archaeological requirements for the property, as well as just not as strategically located. I think as they have decided the location on Panhandle Road, which is in your packet, a copy of the map in your additions packet. Obviously we're not saying to give this to Partners for Pets. We'd have to go back through the bidding process for any no-kill animal shelter that wanted to bid on the property. But because that is the specific no-kill animal shelter in question, they do like this location if the board would consider going out to bid for that.
So moved, Mr. Chairman.
Second.
Okay, we got a motion by Commissioner Hill, second by Commissioner Peacock. This is right there where we used to put the
Dumpster.
yeah, there in front of the EOC. Okay.
Yes, sir.
We have no other plan for that now. At one time, they talked about maybe building a building there because there was a slab, but that's when their interest is probably because of that.
I didn't talk to her about that specifically, but no, we have no plans for that property.
Yeah, I was gonna ask, how does that fit in with this, with the scheme of plans for the Endeavor facility as a whole? Have we given any thought to that?
This is not on, this is out here.
Did they abandon?
You're moving it from there.
They abandoned it? Oh,
You're moving it off of that property.
Oh, okay, I didn't know that.
Yes.
Which I think for the county plans is actually a
Probably
better
yeah.
fit.
Okay.
Yeah.
I didn't realize they had trade.
And if
That's what we're doing right here.
Yeah.
if we're successful and we go out to that bid, it comes back, I'd like to see a caveat in that if that no-kill shelter ceases to exist, that land reverts back to the county.
Absolutely.
Well, it's a lease, right?
Yeah, it will be a long-term lease, but we'll make sure that it's clear that
What was the issue with the property?
Architectural cost analysis for that.
Archaeology.
Kind of an obelisk shaped piece out of it. It's on the south side of the jail, wasn't it? So.
right. I think I said architect. It was the archaeologist.
Archaeologists.
Yeah.
Yeah.
Archaeologists.
That makes
They
sure
have to
nobody camped there, they own 100, 200, 300 years ago.
Yeah, I left it here. Okay, we got a motion and a second, right? All in favor, raise your right hand. All opposed, like sign. Motion carried 5-0. Okay, Mr. Scotty, we could have done this earlier.
Good morning, board members. This is a request for a board approval to purchase a mid-sized bulldozer for road and bridge under prior approved capital outlay funds from last year's budget.
Second.
Got a motion by Commissioner Lockie, second by Commissioner Hill. All in favor, raise your right hand. All opposed, like sign. Motion carried 5-0.
And one more thing, where Commissioner Peacock asked about the location of those monitoring wells on Wintergreen. I got the map. It's up in Two Egg in front of Lawrence Grocery right there. There's quite a few monitoring wells already been in that area, and this one's bigger one they got to put in our roadway.
Thank you.
Hey, Scotty,
Yes, sir.
real quick, before you hang up.
Yes, sir.
So what kind of lead time do they have on that D5? I know you said.
I'm hoping 3 to 4 weeks.
Oh, good. Okay, that's good. That's all right.
Scotty,
But I'll get better answers now that we got it approved, and I'll get with Ms. Daniels, and we'll get y'all to
have them delivered to District 4.
5.
I can get 2 of them. I can get 2 then, right?
Yes, sir.
Not unless you pay for the
I appreciate everything y'all done for me since I've been here.
Scotty.
Yes, sir.
What's the status of the easement for Camellia Acres?
I'll have to check with Michelle on that one.
All right.
I'll get with her and get with you right after this.
Thank you.
Yes, sir. Thank y'all.
Okay. Okay, we don't have anything under the public hearing. We'll move under the community development. And item A was taken off, so we'll be on item B. Miss Wendy.
Good morning, Commissioners.
Morning.
Good morning. This is a request to set a public hearing for a revision of the Jackson County Code of Ordinances, Chapter 74, Article 4, Land Development Regulations, which provides for the regulation and permitting of disaster debris management sites.
Second.
You got a motion by Commissioner Lockie.
That'll be 28th at 9:15.
Second by Commissioner Hill. He beat you a little bit. All in favor for setting the public hearing at 9:15? For the 28th, raise your right hand. Motion carried 5-0. Okay?
Thank you.
Ms. Wendy, item C.
Item C is a request to set a public hearing to amend a development agreement and site plan for Tim Shell Development Group, LLC, also known as Tranquility at Hope School. The applicant is reducing the parking lot by 5 parking spaces due to the reduction of the apartments from 32 apartments to 30. Adding a crosswalk striping within the parking lot to depict ADA accessibility from building to building and to amenities, and adding 121 linear feet of sidewalk from the clubhouse to the Hope School Road right-of-way, and adding 67 linear feet of sidewalk connections on the west sides of both buildings to connect sidewalks in front of the parking lots together to provide connectivity throughout the site on the sidewalks. The total impervious added area is 190 square feet for a total of 74,486 square feet of impervious.
And we got a motion by Commissioner Lockie, second by Commissioner Hill to set a public hearing for 9:15 on the 28th. All in favor, raise your right hand. All opposed, like sign. Motion carried 5-0. Ms. Wendy, item D.
Okay, and thank you for that. This is a request from Justin Stone of Stone's Aquatic Weed and Algae Removal, LLC. They're requesting to submit a variance to allow the Jackson County Code of Ordinances, Section 70-57, to allow a 26 horsepower Kubota diesel engine workboat in Silver Lake to help clean up the lake by removing weeds and vegetation from the lake, as well as trash and other debris.
Commissioner Lockie.
Of course, there is an ordinance on Silver Lake that there's no no outboard
motorized
vehicle, water vehicle, whatever propelled. Yeah, but I don't mind doing that. I think whatever the scope of the work is, if it's 69 days, we need to specify in there that that variance is for 60 days or 90 days or ever.
Yeah, but what does the Do we know what the Community Homeowners Association says?
I haven't, this is the first I've heard of it, when we got the agenda, with the agenda packed, but I have had no one reach out to me. I know that they're very, and rightfully so, a stickler for not wanting that thing to be, invaded, so I don't know the pulse. I'd ask if we would just table this until next week when we're during budget, that we just add it to our budget agenda, and let me reach out to them, because this is.
Does Rhett know anything?
Rhett was the one contacted by this gentleman. If he's on the line, he may can speak to what he knows about the situation.
You would certainly want somebody from that.
Oh, yeah, you want the table. Yeah.
Table it. Now let's table it.
Okay, we got a motion by Commissioner Spires, second by Commissioner Hill to table to next week. All in favor, raise your right hand. All opposed, like sign, motion carried 5-0. Wouldn't the property, whatever,
Homeowners is, yeah, but there's nothing,
to him
we don't
to-
have anything to
Right.
say that they did that.
but he's not just going in there to clean it up for no
But,
reason.
he might
Somebody's
have,
asking.
we don't know, I mean,
Right,
I didn't read
alright.
all the background, but he just promoting what he does and what he's gonna do, but there's no, he may have contracted with one property owner or two property owners
Right.
for that.
Just want to make sure
certain
they all know about it to start with, because
Yeah.
there may be some, maybe, hopefully
Yeah, I
all
don't know
of them
the
they do,
history of the lake, but I figure it would be, they don't want motors in there to be running around all over the place. So this will be there for cleanup,
Yeah,
so
just
we
maybe
can find out.
we'll find out.
Okay, good deal. Okay, so now we move into the other matters, correct? Ms. Apostle Johnson, are you on the line?
Good morning.
Good morning.
Good morning. Can y'all hear me?
Yes, ma'am.
God, Yahweh, sent me before the county commission requesting free counseling for the public on a volunteer basis, granted to give me space to use once, twice, or 3 times a week.
Okay, sorry, Ms. Apostle Johnson, there's no action today.
Okay, thank you.
Thank you. Okay, next, I'm not gonna murder this last name, but it's presentation on face mask requirements.
We'll take a 10-minute break.
Yeah, let's take a break.
What I was gonna do. Yeah, okay. They're suggesting we take a 10-minute break, so we're gonna take a 10-minute break, and we'll be back with item B would be Miss Mary Ann. So we'll be right back.
Ja zrobiłam siebie unmute teraz.
That's what Deborah did to me.
We on?
No, not yet. He muted it from back there, but he couldn't unmute it from back there.
You're unmuted in there.
Very good.
Okay, so we ready to go back?
Yes, sir.
Fred?
Yes, sir.
Okay, we'll go back into session, and on the agenda is item B, and that's presentation, face mask requirements in public due to COVID-19. Miss Mary Ann?
Yes, can you hear me?
Yes, ma'am.
Perfect. Well, thank you first to the board for allowing me the opportunity today to respectfully ask that you consider an ordinance requiring face masks in indoor public spaces here in Jackson County. Next slide, please.
Can you
I can
speak
just,
up?
Yeah, can you
hear me?
speak up some? We can hear you, but it's not.
Or Fred, can you turn up the volume?
I don't have that ability.
Oh, you was loud.
Don't hurry.
Okay, so quickly, I'll just touch on the severity of the issue, obviously, the effectiveness of face masks, as well as face mask ordinances specifically. Next slide. Not to belabor this point, we obviously know that the statistics in the US and in Florida are staggering. And next slide. And as was pointed out today, infections are rising very rapidly here in Jackson County as well. So if we go to the next slide, we can see that face masks are one of the very common interventions that have been pointed to around the world and here in the United States as helping reduce transmission. So we have plenty of research to indicate that it makes a significantly large impact on reducing viral transmissions in multiple scenarios. And we even have anecdotal evidence to support this as well. So if we go to the next slide, we can also see why specifically mandates are needed as opposed to simply urging people to wear masks. First of all, we know that face masks protect others from the wearer. So for the most vulnerable in our community to be truly protected, others around them have to be wearing them as well. We know that people without symptoms can infect others, and also that face masks are most effective or mainly only effective if everyone wears them, with around 80% of the population needing to wear masks to have a significant impact. And then we also know that implementing face mask mandates increases face mask usage, consequently reducing viral transmission and fatality rates. And finally, we know this can help the economy. So it's not just a health issue, it also is an economic issue as well. So on the next slide, we can see that obviously many states around the country, including Texas, have passed ordinances requiring face masks indoors. Several counties in Florida, including Leon County, have passed similar ordinances with the constitutionality of the Leon ordinance specifically being upheld last week. So finally, if we go to the next slide, just want to reiterate again that COVID-19 is a growing problem. Face masks do mitigate the virus's spread, and that mandates increase face mask usage and mitigate against economic damage. So, and on top of that, many local ordinances are becoming more common across Florida. So all of that to say, just want to again, taking all of that into consideration, ask that you consider passing a local ordinance requiring that face masks be worn in indoor spaces in Jackson County. Thank you.
Thank you, ma'am. I guess at this point, we need to open up to if we have any public comments. Fred?
All right. I'd like to remind the public that to speak, you can use the raise hand feature via Zoom or *9 if you are dialed in via telephone. There is a 3-minute limit on talking. And so we'll start with the first one, Joseph Baker. Mr. Baker, you're unmuted.
Can y'all hear me?
Yes, sir.
Okay, excellent. Well, good evening, everybody, or good afternoon, I should say. My apologies. I would like to strongly suggest that we do not mandate a face mask requirement. And I say that for the simple reason that being, this is America and we have a free country. I'm a veteran myself. You know, I think it would be a spit in the face of the people who served and died for this country to be mandated a dress code. Now, on the other side, I can see where they say, well, there's this major pandemic that's going around. However, when you turn your television sets off, it doesn't mirror reality. Because I would like to ask how many people have actually researched what a virus is? My guess would be 0. Dr. Andrew Kaufman, as well as hundreds of other doctors, have stated, and I quote, viruses are produced inside of cells to combat toxins, and the PRC test and so-called coronavirus patients are just testing for exosomes produced by cells under stress from toxins. So mandating people to wear face masks is not going to be a solution other than propagating an agenda. All it's doing is pushing, a false paradigm. I'm not going to go too big on it. I don't want people to say that I'm some kind of conspiracy nut. I'm not a conspiracy theorist. I just look at facts. And some of the facts are that when you walk outside, people tell you that this is a huge pandemic and everyone's catching this big deadly disease. Leukemia kills more people. Why don't we wear face masks for leukemia or cancer or obesity? They kill people. This is not a pandemic, people. Okay? But I'm not going to go too much further into it, but my opinion is to strongly say no. But I've also got paperwork and documentation. If we can, if this is going to be a further issue, but I strongly disagree with the propaganda that's being pushed on your television set because it simply doesn't mirror reality. And at the start of y'all's committee, you prayed to God. And in your prayers, I hope that you are praying to the same God. And by what I mean by that is that anybody who's done a little bit of research can see that there's a bigger agenda going on in America as we speak. And you, right now, on this committee, are personally going to be held responsible for the decision that are going to affect hundreds of thousands of people. So I'm going to leave you with that. Thank you for hearing me, and God bless.
Thank you, Mr. Baker. Okay, next.
Next one is Miss Deborah Buckhalter.
Hi there, can you hear me all right?
Wow.
This is Deborah with the Jackson County, Florida, and I was wondering if your initial presenter there, Ms. Osiaka, could talk about anything that she has in terms of her credentials for health credentials, if she has some, or what is her connection to the
Miss Deborah, you got way too much background noise.
I'm sorry, someone's vacuuming behind me. I'm sorry. Could your presenter tell a little bit about her background?
Miss Mariana, are you still online?
Can you hear me?
Yes, ma'am.
Yes, so I am from Mariana, Florida, since I was 3 years old. Grew up here, have been a resident for 25 years, recently earned a master's in public policy, and have been engaged in civil issues throughout graduate school as well.
Okay.
And on a personal level, I don't know if this is of relevance. I do know several people who have contracted the virus with serious symptoms, have been hospitalized even. So it is also just a personal connection as well in terms of seeing how it has impacted others.
Okay. Thank you. Okay, Fred. Next.
All right. The next one is a caller ending in the number 705.
Okay, caller, state your name for the records.
Thank you. This is Henry Jones. Do you hear me?
Yes.
Yes. I am replying to the presentation by Marianne. I also am a veteran. I also know how a virus works in cells. A virus goes into cells, and the cells make the viruses. The viruses do not make themselves. There are inanimate objects, and all they look for is red meat. Anytime you present red meat to them in the form of a victim, they're going to infect it and go their route. They have no politics. They don't care. Viruses are just viruses. I'm a microbiologist with a master's in microbiology, and I've worked with it all my life, 35 years in the pharmaceutical industry. I've been in charge of and made sterile drugs for many companies, and have also consulted for many companies to be able to engineer and make sterile drugs using clean room techniques where people wear masks, gowns, sterile gloves, and every part of an accoutrement to make a sterile environment, including laminar flow air. The science of what is happening now is speaking, not politics. A virus does not care what politics you have. Wearing a mask for all efforts together, spacing, and doing everything we can is a job that we all have to do together to bring this thing under control. There's no other way. People are finding out that most of the spread is coming when people are getting together in any kind of settings. It doesn't matter. Recently, church in Tennessee opened, and their congregation has been decimated by it. A new church just opening. So there's no handle on that in any other kind of venue. When it's out in public and it's looking for new victims and looking for red meat out there, there's nothing you can do about it except keep it away from people. And the way you do that, first, is to test like crazy. Find out who has it, isolate these people for a period of time to keep the virus from getting to red meat. You take that victory that you have in small areas like pools, like people who work in a certain job, all the people who work in the courthouse, and you test by pools and get them out as groups together to be able to go back to work. But the first thing we have to do to control it is simply wear a mask when you're out in public and keep on contributing to other people where they can take it home unknowingly to their family. I wish to say, too, that not only Leon County, but Gadsden County next door has passed a mask ordinance. And that was passed a little over last week, but it's been in effect for a little over a month over there. I know business owners there that I've talked to, and I also communicate with on Facebook as well, who are very glad that has happened there. Sure. That includes the people as well who have joined in there. It's a united job we have to do, and I'm sorry if I run over time.
Okay, no problem. Okay, next, Fred.
Tell Fred at 3 minutes.
Yeah, I want to remind everybody, just 3 minutes, or Fred, go ahead and cut them off.
Okay, we have no new callers.
Okay. Okay, well, we'll come back here and what's the pleasure of the board, if there is any?
Miss Sheila sent me a question, asked her mic's not working, and she wanted to ask, and I don't know who would answer this, but it just asked was, hold on just a second, get to it. Who's on, Forrester, who's on mandatory, if the mandatory masks are put in place, who's on legislate what will be on the mask? I don't know who would respond. I don't know if that lady.
What do you mean, what would be on the?
I don't know, I just reading what her mic's not working for her, so she asked if I would see this,
Be on the mask or who would?
Yeah, I guess, yeah, well, so, some people are putting things on the masks.
Like
just,
faces and teeth.
yeah, some inappropriate stuff. And then, like if there's profanity or derogatory words would be allowed, and who would legislate or will stop that. So, Ms. Major, if you can hear me, I'm not sure who's gonna answer that since the first speaker.
Sure.
Yeah, Sheriff.
Sheriff Roberts? Sorry. I mean, I don't know.
I don't have the resources to delegate that as a responsibility at this time. I wish I did.
Good answer.
Okay. Ms. Sheila, don't know that we got an answer for that. That's all we can say on that right this minute. Okay, any action by the board?
I
Okay,
would like to thank everybody for their input.
yes, and,
Hand sanitize.
right, stay home if you're sick, wash your hands, wear a mask if you feel comfortable, be respectful to others, and everybody be safe. But at this point, we'll move on to item C. And Commissioner Lucky, did you have to?
No, well, if he's brief.
Okay. Okay, we'll move on to item C, which is GP Strategies. It's an update from Dan.
Good morning, Commissioners. I would like to turn over the first portion to Mr. Josh Norman.
All right, this is where we started a little while ago. The report, starting with the program financial summary. So to date, working with county finance, we have close to 17 million expended related to 4399 or Hurricane Michael. Of that, we have approved expenses of 13,677,000. Being approved meaning the state has validated it and has authorized reimbursement. So now we have total reimbursed to date 12,147,000 with 921,000 pending reimbursements. Pending reimbursement is state showing it's on its way. It hasn't reached our bank account yet. So there will be a little gap between our response of what they've approved and our cost share. That would, we're requesting that from a waiver to cover that. And it's various rates depending on the type of project.
Josh.
Yes.
Hey, this 921,000 you say is on the way. Have we submitted the necessary paperwork for the remaining three other 2.5 million or whatever it is?
Okay, between the gap between these two, some of those they're in review, yes. And some actually are not. So we have some of the costs. Our invoices will be included in that gap. There's currently $770,000 obligated for us. Our invoices are being submitted. That's in the process of being validated. There's another group in MORCAT B, and then there's various projects, but we do know where those are at and if they're submitted or what they're waiting on to close that final gap. And I can provide that report to you. So not all of it is in the state's hand at this time, to answer your question. Although we have it, it's just in queue to be submitted when they get through reviewing the other part. So moving on, currently in FEMA's estimates. So we have our estimates and FEMA has theirs, and we're going back and forth and coordinating on those. Right now, we have a total estimated value for the program of Hurricane Michael at $42 million. That's, again, these are FEMA's numbers. You can see where those line up right now. A lot of it goes to debris removal, 11 million. Emergency protective measures, that's that Cat B, what we did right after this storm. That's what they have allocated for it. And the rest of these are in Cat E, buildings, So we expect that number to go up as bids come in. As you saw with the admin building, what FEMA estimated versus what it actually comes in at has a lot of differences. And then most of that goes to roads and bridges. So currently FEMA has estimated $23 million that go into roads and to the street signs. Overall, we expect the total number to increase to around between 55 and 60 million as we continue to move on over the next several months. A lot of that coming from the roads and bridge of the roads repairs. Next, this summarizes our total number of projects. The projects are the actual grants, project worksheets, where we're at with those, how many have been created, how many are submitted to the CRC, which is FEMA's central processing unit, which helps write them and create them. A little bit of gap there. The compliance reviews go through the EHP and historic reviews, and then the applicants sign. So we have not signed. We're about 10 away from signing all of these, but these are because we don't necessarily agree with everything they've created, and we're in negotiating back and forth to get accurate scopes of work. And then finally, we have this analysis by district of where your projects are. And unfortunately, on this report, it has by percentage. I think that you would like to see total number of buildings and roads, so that the, I guess, purple color is the number of roads, and this 6% is 6% of all roads are in 1, 16%, 17, and so on. How many eligible roads that have been identified and what district they're in. We just have to change that graph to move the percentage to an actual quantity and get you that number. And then here on the end, you have projects that are going to span across multiple districts, such as the debris removal. The Cat C, this roads is actually street signs. So those street signs are everywhere, and we don't have that number broke down, street sign per district. And at least we don't have it in our system. We can create that and customize a specific number of street signs per district. And then next, we're going to move into this July project activities, and then I'll turn it back over to Dan.
Thanks, Josh. So first off, wanted to start out with the 4177 update. We're expecting the notice of award by the end of the month. There's a couple things going into that. Obviously, receiving the bids are due by July 20th. All Day Howell is going to be reviewing the scope, just making sure that we capture everything from an engineering standpoint on that. And then also, if everything goes well, it's a tight timeline to get it to the next meeting. It will be presented to you all at that time for the 28th. Go ahead. Yes, sir.
2 roads that we got notified on?
No.
Last week? Oh,
no,
this is the other roads. Okay, I got you.
Yes, sir.
Go ahead.
Yes, sir. No worries. Thank you. For 4399 signs, right now, working with Ms. Tracy in procurement and working through the performance bond process, making sure that we get everything from the contractor. Mr. Joseph Alday is assisting with the contractor communication on that. We're expecting to get that through the end of this week. So by the end of this week, having that, and then the notice to proceed, our target is the 24th of this month. And that will kind of kick off the beginning of the project, which is kind of a inventory process of inventorying the signs, agreeing with the A&E firm, All Day Howell, and then moving forward with getting those orders to the manufacturer to get those signs created. Any questions on that before moving on? All right. Citizens Lodge, we've got a target to begin staging materials and equipment beginning the week of the 20th, with a target for construction to begin the 27th of this month. Again, obviously the calendar days, so late November, we're targeting for completion on that. All right, Endeavor debris, currently right now, that is in a review process for a time extension with FEMA. They have, typically that process is a 2 to 4 week process. The request was submitted earlier this week for that. So we're keeping on them. We're keeping track of where that's at in the process to make sure that, you know, we're applying pressure to the best of our ability to make sure that that gets done.
I thought they had already approved that.
Yeah, and what are they reviewing?
Because it was out. Go ahead, Josh.
From the sounds of it, it's a time extension, so they might have approved it. By the time it goes through their whole cycle of approvals, our time period is up, and now we have to go back to them and quickly ask for a small extension to complete it.
Yeah, the period of performance expired October 2019. So we're just renewing that.
Just now?
Well, we would have expected that to be done in the process of obligating the project, but as it came to us, it wasn't. So I think we're checking that box so we don't get caught doing it, and then theoretically the obligation should indicate an initial period of performance at that date and moving forward, but and an abundance of caution so we don't spend money and then someone comes back, an auditor, and say you did this without that box being checked. It's kind of where we're at.
Okay, I want to ask a question about the final disposal place for the debris at Endeavor. When is that going to come before the board to see if, where is the final resting place for that debris? At one time,
so
they were waiting on that.
Yeah, that's correct. There was a couple of options discussed, and it is right now, because of pricing for chipping and an additional scope change, we're working through that process to, number one, get pricing, but more importantly, make sure that the scope is correct to include chipping as well. So that will be discussed with the board.
Okay. It comes back to
Josh, how far out are we on that process of chipping? I mean, you know, you talking about RFP, RFQ? What are we talking about? You talking?
It'll go with the projects, the contracts that we have in place.
Okay. So they're getting the pricing on that chipping. Do we have to do it on the Dozier site, or can we look at alternative sites? Maybe.
No, I think that was the discussion. You know, I think we have sites that are already certified, dump that may cost a little bit more. That was, I think, in the original pricing. And then there was a discussion about putting them on site. What are they going to be the cost? Because obviously with FEMA funding, you're going to have to go through a whole additional certification process.
We didn't have all this when we first done all this debris. So I don't understand what the issue is now. And you're talking about pricing and all that. I mean, aren't we still under the same contract with Series?
No, yeah. We'll get Series is the contract we're using, but to certify a disposal site, a new disposal site in Endeavor, I think is the topic. Whether do we do that or we use one that's already approved?
But
use the pre-approval.
Yeah, I mean,
well, my concern was that they were talking about using the place on Endeavor, and I think the board ought to decide whether we want to have that stuff on Endeavor or not. So, that was my concern. Okay?
Yeah,
Yes, sir.
let's get back. That's a concern for sure. And I think one of my concerns with having it on Denver is creating a new, going through a process of getting new registrations through.
Well, we could put stuff we need to move later and we don't want to have to.
John, just for kicks and giggles, what kind of time frame are we looking at? Is a hard number, a hard date that we can say that that place will be cleaned up?
I don't know the time frame from start. Dan, do you know by any chance? I
Yeah.
don't know if it's 120.
So, I mean, no, for the actual removal, if the resources from Ceres isn't pulled somewhere else, they said that they could do it in a 2 to 3 week time frame.
Okay.
But
That's just moving the stumps. That's
end of August.
shipping.
Will, do we know if Austin's start date was serious? I mean, we got the architect in place. I mean,
Archaeologist.
archaeologist.
It's really just depending on the official extension approval and deciding on where to dispose of it. Correct, Josh?
Yeah, and I think we can have that in a map based on when we made the request. Our expectations will be done by September 21st. I mean, July 21st, they get a notice to proceed. They can mobilize and be ready by 1st of August with an expectation that it's completed by 3rd week of August.
Y'all wait long enough, the termites will eat it up.
Yeah.
Or another hurricane will happen.
Seriously, let them kind of allocate some resources that say, listen, put them in the batter's cage or something.
They've been in
Moving or we'll
constant
get
communication. They've been included on all these threads, so they know.
Along with Thompson.
Yeah.
It's Tony.
The site approval and all that, that's all series. They should be handling all that, right?
And Thompson, yes. They're the ones who are bringing those I wouldn't say obstacles, but concerns that, let's look for the easiest path and the least.
I mean, that's
burdensome.
it ain't their first rodeo. They've done it on the whole
Correct.
tree cleanup, so that shouldn't be a problem.
Correct.
They were getting sites permitted within like less
No
than
time.
a week.
Yeah, I mean, yes. So, I don't know. I don't buy
Go back to one of the sites they used and get rid of that mess.
No, I think that's the plan, is to just use one of the sites that's already good that they're approving, and we're kind of leaning on Thompson to make those decisions and make the recommendations. And we're working with FEMA to get that time frame and give the green light. So
the state approves the site, right? What does Thompson do?
So if we're now being talked about creating a new site, a new disposal site that's on Endeavor, that was the discussion that stopped and made everyone pause. I would say, are we going this way, or do we use what we have? What we have, I think, is
Nobody
good. It's just,
they should have been looking somewhere else to begin with.
so I guess I don't know what the process is, but it sounds like Endeavor's not something you're interested in pursuing.
I don't know. I'm not.
No,
Unless you don't give me a good enough plan, they're gonna chip it and fill in some low areas or something, but just to pile the stumps up and the debris in a place that somebody says they don't think we'll use, no, I'm not good with that.
Okay.
Because then, who knows, 5 years, we might have to move it, and then that's another cost to us, the series is gone.
Okay. What we can do is come up with a more detailed plan with some different options. And go ahead.
My thing is, I don't understand why we're making plans. Series, it's their responsibility, or they did to begin with. They should be getting one and start ready. And when they get the approval from FEMA, go to clean it up.
Well, they said they
Understand.
I think the discussion came up about because of the demolition that will be happening simultaneously, theoretically, with David Melvin. There was a discussion, was there a way to work together in that effort? Because he wants to dispose some of it on site and cover it. Because it's cheaper for y'all, for the money that he's got. That's how the discussion even happened, but it's no problem to get a site off.
But I'm not in favor, even if we had to pay a little bit difference, I just say it's up front, because you create problems in the future. Because if any of that, debris is biodegradable. It's on sink. You can't never put nothing on top of it. I mean, I guess you could have buried 60 feet underground and compacted, but I mean, I would be in favor, just go ahead and let them go find a certified site they got, activate that, get that started, and get some price on it. Then let's move on.
Well, and David should bring that to this board too.
Well, I think it's in that.
Well, that's
Well,
FEMA's gonna pay for
Get
this.
in there.
Let's get it done.
Yeah, this is, I mean, it's
Drug on.
We're
too
2
long.
years.
Okay.
And I don't know if
Under-
we accomplish anything here, but at least we're talking about it. Besides somewhere, y'all talking about it. Now we're talking about it.
Absolutely. Okay. So,
So what we'll also do is make sure that you've already given us authorization to move ahead. And
say that last one again, Josh.
I think the board has already approved moving forward with that, correct?
If we have, we can make sure we do it. I mean,
Yeah.
we don't need to wait on
We
it.
wanted to move a year and a half ago.
We have any questions that they don't have that authorization, Willie? Do you think it's in place? Then we can get a consensus right now or a vote.
We can,
It won't
We
hurt.
just want it cleaned
Mr.
up.
Chairman.
This talking is not.
I make a
getting done.
motion that, we give the authorization for Series or whoever to remove that debris to a already approved site off of, Endeavor.
Okay, we got a motion and a second now. If the state will allow them to use that,
Right.
I don't know, their times could be run out.
But it'll be approved. So that motion that was an approved site. So that will be
Approved.
coordinate with them today, make sure that they've got the site in place, and the certifications are ready, and then we'll give you a start date.
And,
They got a half a dozen in my district.
and then the negotiation on price and all that, they got,
Already done.
we using the same contract, I would
Yeah,
think.
it's already done.
Allowed to bid,
Yes.
and they ain't gonna wanna do that, so.
I don't
they
make a
need to-
really big assumption. Hopefully they have this already done, but we just don't know about it. That's an assumption.
Okay.
Their estimate was used to create the project worksheet.
Exactly, yes.
So now they have the.
So we got a motion, by Commissioner Peacock, second by Commissioner Hill. All in favor, raise your right hand. All opposed, like sign, motion carried.
Now get to work.
Get them to.
Absolutely. I'm 100% behind you. Next time you see this, it'll be clear as it was before the storm.
Clear as water.
okay.
Okay.
Thank you, commissioners. Moving on to Neil's Landing and Cypress. By the next special meeting, we will have an analysis cost breakdown for the A&E costs for both of those sites. We're expecting Neil's Landing this week to come in, but I'll throw that into the analysis scope as well for A&E costs. So thank you, Mr. Hill, earlier for challenging that. Spring Creek Phase 1 is complete. That was completed before July 4th weekend. Also, the Phase 2 target completion is July 17th. And that's going to be completing the lower loop of the boardwalk. It's coming along quite nicely. Phase 3 is targeted to finish by July 31st, pending any weather delays that they may have. If you guys can also take a look at the background of the presentation, it does show some shots of Spring Creek down there doing some of the site visits, and just seeing some of the progress that's been made out there. Missy Mossy and company has been doing a really good job keeping the sites clean, keeping areas free of debris, making sure that they're organizing things correctly and safely for the public to access some of the reconstructed areas. So just wanted to give them some props for doing a good job out there.
I seen it Saturday and it's looking good.
Yes, sir. Yes, sir. Pending that, I do not have any other comments, or we can call it the end of the report. If you guys have any questions, feel free to reach out to us, and that includes any report modifications. We're trying just a simpler format, just to show some high level stuff. But obviously, if you guys want some more details thrown in, we're more than happy to provide those for you guys.
Thank y'all.
Yeah, thank y'all.
Yes, sir. Thank you.
Oh, while I got you, you notice nobody said, "Where's my money?"
Yes, sir.
But where's the rest of my money?
The rest of it.
Yes, sir. Understand.
New
Collins,
votes waiting on approval.
with Collins Road and Sweet Pond being moved forward, all those were submitted at the same time. Well, and those additional ones that we haven't seen yet. So
They were submitted at the same time. My three should have been submitted before Sweet Pond. So that's.
but they went to FEMA from the state
At the same.
in around March after we basically brought them back to the table. So I would expect there to be several more of these coming, and we'll be caught up on all those approvals.
What was that PW? You think the shallow and shallow church loop, is that the right one? And Cypher. What was the PW?
The number on it?
980.
Yeah, I don't know if it was or 981. I think the one that just was approved was 980. So
Yeah, that's what I meant. But I need to know what them other two on, and if you would, just text that to me, please.
okay.
Okay. Anything else while we got them? Okay, thank y'all.
Okay.
Thank you.
Okay, Michelle, are you still on the line? Do you have anything?
I'm here. I don't have anything.
Okay. Ms. Willan?
I just wanted to make sure y'all know that we have a new website. I don't think I've said that at a board meeting yet, jacksoncountyfl.gov. We're still working on it. If you see anything, I mean, it's basically complete, but if you see anything that looks like it needs fixed on your pages, if you want your bios changed or anything like that, or otherwise, just let us know. That's it.
Michelle, can you hear me?
Yes, sir.
Hey, I need that temporary easement for Camellia Acres as soon as you can get it to me or get it completed.
We have a legal description for the easement.
I gave the stuff to Scotty. He should have it.
Okay.
I'll get it to her right now.
Thank you, Scotty.
Yes,
That's
sir.
all, Chairman.
Okay, Commissioner Hill? Commissioner Spires?
No, sir.
Mr. Rooks? Sheriff? And I have nothing. Anybody else have anything? This meeting's adjourned.